शिरूर
वाघोली फारच वाईट तिकडे ना फ्लायओव्हरच पाहिजे मॅडम संध्याकाळी.
या वाघोली झाले
आहे ना. रुबी हॉलचा प्रोग्राम होता, सो आय हॅव टू गो. इवन आय कुड नॉट गो ऑन झूम बिकॉज कार मध्ये माझ्याकडे रेंजच नव्हती. आय कुड नॉट रीच ऑनली होम.
Pranjal is
Yes,
okay?
sir.
Huh?
Just 2-3 seconds, sir.
Okay.
प्रांजल त्याचं नाव आहे?
हो सर, माझं नाव आहे
होय
Pranjal.
काय? अच्छा, आय थॉट प्रांजल इज सम गर्ल और लाईक वाईज. आय एम सो सॉरी, डोंट टेक इट
No,
अदरवाइज.
no worries, sir. No worries.
हे माझं मोठं कर, सेंट्रलाइज कर. डॉक्टर सुनीता तांदुळवाडकर डिवाइन.
आज मदनराव पारुल दोघांनी टॉपिक छान ठेवलेत. नाईस टॉपिक.
Oh, thank you.
ग्रेट.
Sir, we are
Achha.
live now.
Yeah, okay. Thank you.
We can start, sir.
Okay, good evening, everyone. On behalf of Amogs Sexual Medicine Committee and Young Talent Promotion Committee of Amogs, myself and Dr. Parul Sharma, we take this privilege to welcome all the
पारुल सावजी.
all the faculties and all the delegates who have joined for this webinar, which is the special episode, Sexual Health for All. This is the 4th episode. With the blessings of Amogs office bearers, President Dr. Kiran Kurtkoti sir and Secretary Dr. Bipin Pandit sir, and all the executive members of Amogs. For this session, we have got the eminent personalities as our today's guest, chief guest, respected Dr. Sunita Tandurwalkar madam, guest of honors Dr. Parag Beniwale sir, respected Dr. Amey Purande sir, dear Dr. Ajay Wane sir, and all the chairpersons, Dr. Brajbala madam, Dr. Rashmi Kahar madam, Dr. Varsha Lahade madam, Dr. Nibha Mohan madam. I welcome all the chairpersons for both the sessions and today's wonderful speakers, Dr. Dipti Gupta and Dr. Poonam Mishra ma'am, and the panelists for today's session, Dr. Narendra Malhotra sir, Dr. Girish Mane sir, Dr. Sudha Tandon ma'am, Dr. Deepa Mukundan, and Dr. Sita Lakshmi hai. Yeah, 1 second. I would like to share the screen. Yes.
Okay, full screen, sir.
Yeah. First we will have our Amogs official song, which is to be played. This is the Amogs official song.
जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. वरदा कृष्ण कोयना भद्रा गोदावरी. वरदा कृष्ण कोयना भद्रा गोदावरी. एकपणाचे भरती पाणी मातीच्या घागरी. एकपणाचे भरती पाणी मातीच्या घागरी. भीमथडीच्या तट्टानाळा, भीमथडीच्या तट्टानाळा यमुनेचे पाणी पाजा महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा भीतीन आम्हा तुझी मुली ही गडगडणाऱ्या नभा भीतीन आम्हा तुझी मुली ही गडगडणाऱ्या नभा आसमानाच्या सुलतानीला जबाब देती जिभा आसमानाच्या सुलतानीला जबाब देती जिभा सह्याद्रीचा सिंह गरजतो सह्याद्रीचा सिंह गरजतो शिवशंभू राजा दरी दरीतून नाद गुंजला महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय महाराष्ट्र माझा गरजा महाराष्ट्र माझा जय महाराष्ट्र
Yes, thank you all. Welcome all the dignitaries to join the limelight. Yes. Thank you, all the faculties and all the dignitaries for this inauguration. It's my privilege to welcome today's chief guest, none other than Dr. Sunita Tandurwadkar, ma'am. Everyone knows, actually there is no need of introduction, ma'am. Everyone knows, madam is I would like to say it's a 3D personality. Dear most dynamic and dedicated personality, which is lovely personality from Foxy. Everyone love Sunita ma'am. Yeah, ma'am is the president-elect Foxy and past president of
आता
UOJ.
short नाहीये. Don't worry. Don't waste your academic time.
Yeah, okay, ma'am. We need your blessings. Please, over to you, ma'am.
Hi, can we stop the screen sharing? I would
Yes.
like to see you all. First of all, Madan, I also love you all.
Thank
I
you,
love
ma'am.
you all, and that's why every day, 2-3 webinars, I always try and attend and be with you all. It's nice to sit in your cabin and meet your friends across the country. You love them, and I'm thankful that you have invited me. About Amogs, I know the way Amogs is functioning, every president is doing what they can do at its best. And that's why I think this state of Maharashtra has outshined the other states. I'm sorry to say, but that's truth. Sexual committee, sexual medicine committee in last 4-5 years, the way things are happening, the way the programs, the involvement, the awareness, and most importantly, your panel discussion today about how to be non-judgmental. So I think I should give a credit. Neeraj, he chose a very good national coordinator, Apurva, who is doing amazing job. And he chose another great national coordinator, Madan Kamble, who happened to be also the Amogs committee chairperson of sexual medicine. So I'm really thankful. I never knew this will create, because 2-3 times I joined Apurva's webinars when I was going through election, and the attendance was 300 and 400. It was amazing. So there are a lot of things, probably this topic, we don't waste much time in reading about it. And it's nice to attend the webinar and listen to these well-read people and just optimize your knowledge and help your patients in that way. And that may be probably the reason why these webinars are very well attended, even over the endoscopy or infertility webinars. So congratulations for always taking this part. Today we have Dr. Parag Piniwale, ICOG. Now it's a great privilege that he will be the ICOG chairperson with me. And I think we both are making a history that ICOG chairperson and the Foxy president from the same city and very good friends for a decades. So naturally, I'm sure we both will have a gala time together. Ameya Purandare, who probably should have been here. I'm sure he must be having some problem, but lovely to see Ajay Mane, our vice president. I know how much he was interested in working as a vice president, and I'm sure Dr. Jaideep Tank must be proud of him. Your panelist, I must say, Narendra Malhotra, Girish Mane, Sudha Tandon, Deepa, and Sita Lakshmi. It must be a very good panel if everyone joins. And Dr. Poonam Mishra and Dipti with your chairpersons, Brish Bala, Rashmi, Varsha, Nibha. I'm sure you all will have a great time. And I think Ameya Purandare just arriving. Lovely to see him. And it will be so great that he will be also there in my Foxy committee. I think Parag Biniwale and Ameya Purandare, I can label them as an advisor also. True advisors, because they will not just advise, they will advise me out of the interest and out of the goodwill. So lovely to have you all. And Parul, you are a shining star, yeah. Keep your smile always. I think your husband may never fight against you, or if he fights, he never wins because you just give one smile and he's dissolved. I always feel that. Smiling face is the best. I always, whenever I see Parul, and I always feel कि वैसा ही ना हमारा बालकृष्ण है, उसकी बीबी भी last 35 years, she's our anesthetist. I'm seeing her, she's the same. When I see her, I get that feeling only कि the husband can never win the fights with you all. Thank you. Our husbands also cannot win because we are too dominating.
True, ma'am, true. And thank you. All these words coming from you, they just mean a lot to me.
No,
And
no.
you are just an inspiration to all of us, ma'am. Looking
No, no.
forward to, being
Amogs
in your
committee,
tenure.
everyone works so hard. And I should congratulate Kiran for that, because true leaders makes everyone works beautifully. Thank you.
Yes, thank you, ma'am, for your kind blessings and kind words. Thank you. You are always with us. Thank you. Yeah. It's my honor to welcome today's guest of honors. We are so lucky to have eminent personalities, Dr. Parag Biniwale sir, Dr. Ameya Purandare sir, and Ajay Mane sir. Yeah. Dr. Parag Biniwale sir is the chairperson-elect ICOG and state coordinator of Amogs. Yeah, welcome, sir. Please.
I'm sorry, I'm in the car. I'm
okay, sir.
Right now. Good evening, and it's indeed a pleasure to be sharing virtual dais with very dear friend Sunita, Ameya, and of course Ajay Mane. Madan, hats off to you for coming up with this program, and I'm happy that you've collaborated with the Young Talent Promotion Committee. Being a past chairman of Foxy Young Talent Promotion Committee, I always have a soft corner for this, and I still remember Ameya was one of my committee members when all of us were very young at that time. You have put up a very good program because infertility and sexuality are, one very as well as, it is a big concern in women in the postmenopausal or perimenopausal age group. I'm sure it's going to be a great learning experience. My best wishes for the program, and I can see all the aspirants of Foxy committees. So best wishes to you all for your forthcoming election. And I'm sure you all will do a wonderful job when you get elected. Thank you very much.
Thank you, sir, for taking time for us. Thank you for your kind blessings.
Thank you, Parag, sir.
Yeah, I would request Parul to introduce the next guest of honor, Amay, sir.
We would like to have Dr. Amay Purandare, sir. We welcome you, sir. Sir is a consultant obstetrician and a gynecologist at Purandare Hospital. He's the Senior Vice President, Amogs. He was the Joint Secretary for Foxy in 2019 and has held many posts at Foxy. He has done exemplary work being the Secretary of Amogs in 2014-15, being the Zonal Coordinator in 2015-19, and the State Coordinator in 2020-22. Sir has had a remarkable journey all this while, and we know how hard he has worked. He has astounding achievements, which are, just to name a few, he has achieved the Dr. A.E. Dastur Gold Medal and Dr. B.N. Purandare Gold Medal. He's also achieved the Amogs Dr.
Parul, thank you
Acharya.
so much.
We are, sir,
Okay.
so much in awe of your prodigious work and the stupendous energy which you bring into Amogs and Foxy. So we welcome you wholeheartedly.
Thank you, Parul, for those kind words. And sorry, I'm in very poor network area, even though I'm in the center of Mumbai, but there's some major network failure here. Madan, congratulations once again. I think every webinar that you organize, you are more and more successful. It is indeed good to see that you are collaborating with the Young Talent Promotion Committee Chairman, Dr. Parul, who is also one of the young and vibrant chairpersons of Amogs. It is a privilege of Amogs to have amongst our our own family member, Dr. Sunita Tandurwadkar, who will in a few months be leading Foxy. And I think it is a matter of great pride that Madam is here to bless us this evening. Also, Dr. Parag Biniwale, who will be holding the hem at ICOG. And I think Amogs, ICOG and Foxy will collaborate immensely in the years to come. Once again, congratulations to Madan and Parul. I think it is an excellent program, very well thought of high scientific content. And last but not the least, I'm indeed very thankful to all the chairpersons, conveners, speakers, and delegates. My special wishes to all the Amoxians who are contesting and wholehearted support goes out to all of you. So thank you once again. I'm sorry I'm in poor network area, so I may not be very clearly audible.
Thank you so much, sir. You joining in with whatever network issues you have means a lot to us. Thank you so much, sir. Thank you. We'd like to welcome the next guest of honor, Dr. Ajay Mane, sir, who has been unbelievably and miraculously doing a lot of work. He's the Vice President, Foxy West Zone 24-25. And he has been the past president for Aurangabad OBGY Society. And sir has been having an exemplary personality. So we welcome you wholeheartedly to our webinar series number 4. So welcome.
Thank you, Parul, and thank you, Madan Rao. Basically, thank you very much for inviting me here. I'm not basically guest. I'm the elder brother of Madan Rao and Parul. So I'm here in that relation basically. And what Sunita ma'am said, you both are a shining star of Amogs, and very soon you will be becoming a national stars. So that is my bhavishwan basically. Respected Sunita ma'am, my brother Kiran, respected Bipin sir, and obviously the co-stars of today, Madan and Parul, and my brothers Parag and Ame. They have given you best wishes. I told you that the committee is growing day by day, and the Young Talent Promotion Committee has joined hand in hand to Sexual Medicine Committee. It is very nice that two committees, because they can have two hands and they can work more in spite of having great coordination between the two chairpersons and the two committees. The today's topic very nicely chosen, infertility and sexual dysfunctions, because they are interrelated. Always we are ashamed of speaking about the sexuality. Means the gynecologist, we are not ready to speak, then how a patient can speak. So I always say that keep a board in your notice board that the sexual medicine problems can be discussed between 3 to 5 and keep the time always apart from your regular OPD. Because the patients, they are coming to such problems, they are speaking in front of us. So we are for this purpose. So they will be speaking very openly. So keep the timing separate and have a separate OPD for sexual medicine problems. This is my advice to all the consultants who are listening today. Secondly, the sexual issues in perimenopausal period, it is very important because the psychosexual disorders starts in the perimenopausal. It is seen most of them. And the third panel discussion is very great. How to be non-judgmental in dealing psychosexual issues in practice. We are always judgmental in our practice. ये ऐसा क्यों किया, वैसा क्यों किया? Likewise, when I took the committee in the FOXY, Sexual Medicine Committee, in 2014, everybody laughed at me. कि अरे क्या वो नॉन मेडिकल कमिटी लिया, कुछ काम का नहीं, कुछ प्रोडक्शन नहीं, वो कमिटी बंद पड़ने वाला है. But I took the committee with the help of my committee members to number 1. And now everybody is after that. कि वहाँ competition उसका लिए elections हो रहे now. So and the next chairperson will be Madan, obviously. Very nice, very nice. So I congratulate Madan Bhai, I congratulate Parul to have a great stars of chairpersons, speakers, and I convey my best wishes to the aspirants, Dr. Brijwala Tiwari, Dr. Nibha Mohan, Dr. Mukundan from out of Maharashtra for the contestant for the elections, upcoming elections in the FOXY. So best of luck. And our own candidates, Dr. Varsha and Dr. Rashmi. I request all of you to kindly vote for them, support them to go in the FOXY and be a shining star. So best luck to all of you, all 5 members. Basically, they are from Amogs and you all are our family now. So best luck to you and very soon, see you soon there in FOXY. So thank you, Madan, and thank you, Parul again.
Welcome, sir, and thank you so much for joining in, sir. Thank you so much. I would now like to hand over the session to Dr. Madan Kamble, sir, to take it from here. Over to you, Madan, sir.
Thank you again, respected chief guest and our guest of honor. Thank you special for Ajay, sir. I would like to say something about sir. He is the person who dragged me into this Amogs. He is responsible, and I'm very much thankful for you.
So I think it is infectious that Ajay sir dragged you and you dragged me.
Yeah.
One or the other, it is always like that.
Such a lovely and supportive person, Dr. Ajay sir. Thank you, sir, for coming. Yeah, we will move on to scientific sessions. And my best wishes for all the contestants for FOXY elections, Dr. Deepa ma'am, Brajbala ma'am, Deepthi ma'am, Nibha ma'am, and our Rashmi ma'am and Varsha ma'am. Best wishes.
Best wishes from both the committees of Amogs, YTP also and Sir Sexual Medicine Committee also.
Thank you,
Parul.
Thank you so much, Parul. Thank you so much.
Thank you so much.
Thank you so much, everyone.
Yeah, thank you so much for having me over from an outsider. Ajay sir.
Yeah. Thank you, Deepa and Brijbala ma'am, because I have seen your comment on our Maharashtra Geet. Maharashtra Geet is very inspiring Geet, and the shooting is done by Kiran's friend, and it is very nicely and very, very inspirational song. So it is very really Maharashtra Geet, and Maharashtra is very great. You know, you come to Maharashtra and you will be inspired.
Sir,
Thank
it's
you, thank you.
Secondary member.
It's Maharashtra means big, and I'm very much associated with Maharashtra. So many relatives, and you all are my relatives.
Yeah, I want to call Amogs amazing Amogs, and I want to become secondary member.
Yeah.
Everybody is so illustrious.
Thank you.
Okay,
Thank
for
you
the
for
session,
appreciating Amogs. Thank you.
We are starting the session 1, which is infertility and sexual dysfunctions. For this, we have got the esteemed chairpersons, Dr. Brajbala Tiwari madam and Dr. Rashmi Kahar madam. Yeah, I would like to introduce Brajbala ma'am, who is the past president of Indore OBGY Society, vice president Indore Menopause chapter, past vice president and secretary of Indore, joint secretary of MP ISAR, past secretary of IMA also, or she has organized so many conferences, and she is also PCPNDT representative to the state government. And she was also organizing Joint Secretary ISAR 2023. I welcome ma'am.
Thank you, Dr. Madan, for kind introduction. Thank you so much for making me part of this.
Yes, thank you. Yes, second is our own Dr. Rashmi Kahar madam, who is great dear friend of mine. She is the president of Obstetric Gynec Society of Amravati and chairperson, I would rather say best chairperson of high risk pregnancy of Committee Amogs.
Thank you,
Yes.
Madan sir. Thank you very much.
And director at Karadukar Maternity Hospital, Amravati.
Thank you.
I welcome both the chairpersons, and I request them to introduce Dr. Deepti Gupta madam, who is the speaker for this session.
Shall I introduce, sir?
Yes, Rashmi. Yes.
Yes.
Yeah,
Thank you, sir.
please.
Dr. Deepti Gupta, a very dear friend of ours, and we know her from her immense work in quiz committee. We wish her best in her future endeavors. She's associate professor, NSCB Medical College, Jabalpur. She's a consultant and unit head, Ankur Fertility Clinic of Jabalpur. She has been at present working as secretary of AMPOGS and immediate past secretary of Jabalpur OBGYN Society. We know her work as West Zone coordinator of Foxy Quiz Committee and Foxy Gurukul Medha. She is a co-convener of Foxy Quiz Committee webinars on Badlav and OBGYN 360. She is quiz master in Foxy Quiz Committee webinars and is a national corresponding editor of Jogi and peer reviewer of Jogi. She is also co-editor of Foxy Focus on RPL. She has contributed many chapters and Foxy GCPR on obesity in pregnancy. And I think she must be having more than 70 to 80 faculty participations with more than 20 papers and chapter publications. So it's a great honor to have Deepti, and she will be talking on infertility and sexual dysfunction. And I would like to request Deepti to kindly go ahead with her talk.
Thank you so much, Rashmi ma'am, for that generous introduction. And I would like to take a few seconds to extend my heartfelt gratitude to our President-elect and dear Chief Guest, respected Sunita Tandulwadkar Madam, our esteemed guests of honor for the day, respected Parag Beniwale Sir, respected Amay Purandare Sir, and respected Ajay Mane Sir. I completely, absolutely reiterate what Sunita Madam and Ajay Mane Sir pointed out, that Amogs is actually on a roll, and as secretary of MP-OBGY, all MP-OBGY association, I can feel the heat and a lot of pressure to step up our activities and do more good work. And I'm extremely grateful to Madan Sir and Dr. Parul for this opportunity. And with your permission, I would like to start my presentation. So I was allotted the topic of infertility and sexual dysfunction. And all of us know that sexual health and wellness is actually, there is a lot of importance. It shows a lot of importance of self-care and communication in intimate relationships. Now, when we talk about infertility and sexual dysfunction, it is like that murge and ande ki kahani, or asking what is at the end of the rainbow when we don't even know where is the end of the rainbow. So on one hand, infertility can induce, worsen, or aggravate sexual disturbances and disorders. And on the other hand, sexual disturbances themselves can contribute to subfertility, giving rise to a very ugly and a traumatic vicious cycle. So what is sexual dysfunction? Sexual dysfunction is largely alteration in one of the sexual response cycle phases. There are different phases of sexual response cycle, and any alteration in any of these phases is defined as sexual dysfunction. So clearly, these infertile couples that we see, on one hand, when they come to the infertility clinic, suddenly their sexual behavior is under scrutiny. In fact, because of the various advices given, it becomes more of a attendance, more of a checklist rather than actual lovemaking. And there is, prolonged and mutual agony and guilt in both the partners individually and collectively. And then, of course, a lot of times it is further aggravated by underlying medical conditions. So now, how big is the problem? Sabka nazariya alag hota hai. To some of us, it may seem like a very trivial issue, but to the couple facing the sexual dysfunction, it is the entire elephant itself. So the prevalence in United States is reported to be about 10 to 52% among men, and as anywhere from 25 to 63% among women. And this systematic review published in Indian Journal of Psychiatry says that in India, sexual dysfunction may be present in as many as 22.2% to 76% of the population, based on the screening tools of Arizona Sexual Experiences Scale and IIEF. I'm sorry, my screen seems to be stuck. Just a second. Okay, so moving on, 21 to 1.5% of the male subjects were actually diagnosed to have one or more sexual disorder, and erectile dysfunction was found to be present in 15.7%. Male hypoactive sexual disorder contributed to 2.56%, and premature ejaculation was prevalent in 8.76%. Around 14% of female subjects were diagnosed to have some form of female sexual disorder, wherein HSDD was the commonest and sexual aversion disorder was the least prevalent. When a comparison was done between infertile couples and fertile couples, the sexual satisfaction was clearly found to be significantly lower in infertile women, men, and couples compared to those without fertility problems. And as you can see, there are quite a few published papers supporting this statement. Also, an important point to remember is that while sexual satisfaction may be initially similar, however, once the diagnosis of infertility is made and as the duration of unsuccessful treatment increases, the sexual satisfaction decreases. We must remember that up to 5% of fertility can be solely because of sexual dysfunction. In fact, out of these 5%, as many as 2/3 may be managed without subjecting them to expensive and exhaustive treatment, which is why we are probably having this discussion. A common denominator between male and female factors is inability to have adequate sexual intercourse because of various stress factors, distance factors, incompatibility factors, and psychosocial factors. So, you know, in a lot of our populations, to start with, right from adolescence, there is poor knowledge and awareness about the basic reproductive physiology and the genitalia. There are so many religious and cultural barriers. Add to it myths, misconceptions, and phobias. And then, of course, comes the performance pressure, anxiety, and guilt. I'm sure everybody remembers that scene from Aishwarya Rai and Salman Khan scene where, you know, after the kiss, Aishwarya Rai asks him that, am I going to be pregnant? So what are the different categories of sexual dysfunction? Depending on the various sexual response phases, it could be desire disorders, which includes lack or loss of sexual desire, sexual aversion, excessive sexual drive, arousal disorders like failure for genital response, orgasm disorders like orgasmic dysfunction, lack of sexual enjoyment, premature ejaculation, pain disorders, which will include the non-organic dyspareunia, non-organic vaginosis, and other disorders, including paraphilia and gender identity disorders. So this is a brief summary based on the DSM classification, wherein in terms of men, the desire disorders would include male hypoactive sexual desire disorders, arousal disorders would include the erectile disorders, orgasm disorders would include delayed or premature ejaculation, and the pain group would include penodyne or scrotodyne. Vis-a-vis for the females, female sexual interest or arousal disorder, followed by female sexual arousal disorder, orgasmic disorder or anorgasmia, and then the genitopelvic pain or vaginismus. Interestingly, in women, the highest rates of dysfunction were found to be in desire and arousal, followed by satisfaction and orgasm. For men, according to the ranking in domains of IIEF and a study using the sexual health inventory for men, the strongest impairment was found in desire and overall satisfaction, followed by erectile dysfunction and premature ejaculation. Now, coming to the brief overview of causes. This is a huge realm completely out of scope of this discussion today. The causes may include the physical or the actual organic causes. medications, we must remember the patient may be taking some medication for some underlying condition which he might have ignored. And then, of course, the psychological causes. So it is very important and empirical that we always rule out organic or medical cause before diagnosing the patient as a psychogenic sexual dysfunction. When I was going through the literature, I was surprised to see that there are almost 15 dimensions with reference to sexual health, with almost 60 plus scales which are available for use as per relevance. Now, a little bit about sexual dysfunction and male infertility. So as you can see in this chart here, that starting from lifestyle factors like obesity, substance abuse, drugs like antidepressants, anticholinergics, cardiovascular drugs, environmental factors, especially environment and health is becoming a big thing now. Unknowingly, we are exposed to so many pollutants. And then, of course, the underlying diseases, especially diabetes mellitus, cardiovascular disease, and chronic kidney disease. They all can contribute to sexual dysfunction, of course, along with psychogenic factors. So there are a lot of psychological concerns about infertility, which may further underlie sexual dysfunction. And like I said, we must not forget the effect of medications. So hypoactive sexual disorder and lack of sexual satisfaction were the most prevalent types. The range surprisingly varies a lot, from 8.9 to 68%, perhaps because of varying sensitivity of the subject who is answering the questionnaire and also some reluctance in reporting. The results for specific sexual disorders also were different between infertile and fertile men. Erectile dysfunction and or premature ejaculation had a prevalence of as high as 1 in 6 infertile men, and orgasmic dysfunction had a prevalence of as high as 1 in 10 infertile men. This is a busy but important table which shows that the prevalence of sexual disorders in males increases with age, is more related to educational status, being more prevalent in the poorer education group, is also related to socioeconomic status, and is also related to chronic medical illnesses and substance abuse. A study had reported that as many as 152 million men were suffering with ED in 1995, and this number was projected to increase to 322 million by 2025. Like I mentioned, ED prevalence increases as a function of severity of semen quality impairment, even after adjusting for other co-founders like the metabolic parameters and the hormonal parameters. A very important thing to remember when we are dealing with our fertile patients, that erectile dysfunction without a history of any other cardiovascular disease in itself has a 45% increased risk of having a subsequent cardiovascular event. I think this itself is a very strong reason to start inquiring about sexual dysfunction. It is further associated with a number of other easily treatable underlying factors. Therefore, it is also considered a proxy of general health as far as the male partner is concerned. So this is another graph depicting the same thing, that ED increases with increasing age. This is a brief overview of management strategies for erectile dysfunction. We are all familiar with medications like sildenafil, tadalafil, which are essentially phosphodiesterase 5 inhibitors. They are to be used with caution in patients on alpha blockers and in patients who have some kind of cardiac risk. If these don't work, then intracavernosal injections can be considered. Especially they are recommended for patients with spinal cord injury. Furthermore, we have vacuum erection devices, low intensity extracorporeal shock wave, and then of course the penile processes implantation. However, for all that, I'm sure all of us would prefer referring the patient to our urologist friends. Now, a little bit about ejaculatory dysfunction. Aspermia, we know, is a lack of seminal emission or retrograde ejaculation. This can be seen with ejaculatory duct obstruction, spinal cord injury, radical prostatectomy, pelvic trauma, diabetes mellitus, multiple sclerosis, and neuropathies, most commonly diabetic neuropathy. Coming to premature ejaculation, it is essentially a triad of short ejaculatory latency, a lack of control over the ability to delay ejaculation associated with personal distress. The prevalence has been estimated to be between 15 to 19%. And the highest prevalence was observed in men with azoospermia, and the prevalence was significantly less in men who had at least fairly good sperm parameters with abnormality in only one parameter perhaps. Coming to another important category, the hormonal dysfunction, also commonly referred to as the diminished libido. Now, a word of caution here that exogenous testosterone replacement therapy should be avoided because it is actually going to cause iatrogenic suppression of the HPG axis, that is hypothalamo-gonadotropic axis. Rather, alternative therapies for testosterone optimization like selective estrogen receptor modulators, aromatase inhibitors, and HCG should be considered, which are actually going to act on the hypothalamo-pituitary gonadal axis. Now, moving on to female sexual dysfunction. For female sexual dysfunction, FSFI, that is Female Sexual Function Index, is considered the gold standard for diagnosing sexual dysfunction. Using this, the range of desire disorders in infertile women was reported from as low as 15 to as high as 99%. The prevalence of vaginismus was about 15%, and that of dyspareunia was higher from about 9 to 54%. Now, what is this FSFI? It is actually a 19-question scale. Those in teaching and research are familiar with the word Likert scale. So it has 19 items which use a 5-point Likert scale. And to score the measure, the score of each domain is multiplied by a domain factor ratio to maintain the standardization. And the FSFI largely focuses on sexual activity within the last 4 weeks. So the score in FSFI ranges from 0 to 36, where the lesser score means severe dysfunction and the higher score means almost no dysfunction. So this is the FSFI summary. As you can see, there are different domains and the question numbers pertaining to different domains have been enlisted with score range and the multiplication factor. So the maximum score for each domain comes out to be the same of 6. Based on FSFI, it was proven that fertile women had a higher score than compared to infertile women. And what were the principal dysfunctions presented? Principal dysfunctions were 33% were of desire, 20% lubrication, 7% pain, 20% pertaining to orgasm, and another 13% pertaining to satisfaction. So this was from a systematic review published in 2021. Also, a paper published in Human Reproduction, the official estuary journal, quoted that there was significantly higher overall female sexual dysfunction in infertile women compared to fertile women. With infertile women had a significantly lower total FSFI score. Another paper by Tanha et al. Said the same thing, that infertility and sexual function compared the FSFI score, and there was a higher total score in the control, that is the fertile women, compared to the infertile cohort with a significant p-value. Now, moving on to the actual medical disorders which we come across in infertility, without which our discussion would be incomplete. So thyroid disorders actually do have a significant component of sexual dysfunction. It could be from painful sex to hypoactive disorder, to decline in drive, to depression, to erectility. This study quoted that a global prevalence of male sexual dysfunction was 51%. In hypothyroidism and hyperthyroidism respectively. So sexual dysfunction in hypothyroidism ranges from 59 to 63% in men and 22 to 46% in women. In hyperthyroidism, it is about 48 to 77% for men and 44 to 60% for women. Both hypo and hyper were strongly associated with erectile dysfunction. Hypothyroidism largely with delayed ejaculation. And both of them have been reported to impair libido in men and women. We often ignore the male partner evaluation for thyroid profile and prolactin, which should be a routine evaluation along with the viral markers. Likewise, hypo and hypothyroid women demonstrated impairments in desire, arousal, lubrication, satisfaction, and pain. Coming to PCOS, these PCOS women suffer from obesity, hirsutism, acne, which all, flare up the body image issues. So the prevalence of sexual dysfunction in PCOS have shown rates ranging from 27 to 62.5%. Endometriosis, another very common condition. We know dyspareunia, in fact, is one of the, criteria for diagnosing endometriosis. And there is also associated fatigue, anxiety, and depression. And as many as 47% of patients had sexual dysfunction. And this was a paper published in our ESAR journal by Dr. Vineet Mishra, sir. So patients with endometriosis also commonly had arousal and orgasm dysfunction. So that brings us to the clinical assessment of sexual dysfunction. We would be starting with a thorough medical history, including past history, chronic medical conditions, any neurological, malignancy, surgical procedures, current medications, covering the psychological factors, including anxiety, social, general, any OCDs, any attention deficit, any substance use, any performance anxiety, any body image issues. And then we will do a routine investigation wherein we need to look at the glucose profile, the lipid profile, the hormonal profile as and when relevant. And we must not ignore the prolactin and the thyroid profile. Now, the management strategies, of course, there are specific medications for specific entities, but broadly speaking, we have to advise the patient to stop smoking, omit or limit alcohol consumption. We recommend indulgence in exercise. Diet should not be ignored. The focus should be on, fresh fruits and vegetables rich in antioxidants. We need to discuss stress management strategies, whichever method works for them, be it dance, be it exercise, be it art, be it, some kind of support group. We need to involve them in communication between the two partners, and some kind of counseling with psychotherapy may be needed. And then, of course, we have to treat the underlying pathology, if any. So as you can see, infertility and sexual dysfunction is a big paradox. As you can see in this top picture, on one hand, sexual disorders can be secondary to the increasing awareness or confirmation of a fertility problem, or to the strategic treatment to overcome fertility, as there is loss of spontaneity. In fact, there is a paper which has proven that female sexual dysfunction actually increases in the fertile period. And I am sure all of us have come across couples who come back and say ki humne sare papers fek diye, sara treatment band kar diya, and then we conceived. So probably there is some truth to it. In fact, failure, there were a lot of couples who reported failure of advised timed intercourse in as many as 26%, because they feel an invasion of privacy and they see this treatment as a fault-finding exercise. There is always the feeling of pressure to perform, which adversely affects sexual functions, which gives rise to a vicious series of fear of failure. There is distress and anxiety. And this sexual intimacy is said to be on terms and conditions. And eventually lovemaking becomes a battleground for control, power, and the quest for a child. So I come to the concluding slides. This is a very complex slide. The red arrows are the important ones which we need to focus on because they require reinforcement. The green arrows show the areas for improvement, and the yellow arrows are the ones which can have positive and negative effects both. So starting from culture, society, and family, to self-concepts, to mental health, to the characteristics of infertility itself, and then mix it with characteristics of sexuality, the female sexual disorders, the male sexual disorders, and that brings us to the counseling, therapy, and the actual treatment part, which would eventually give the happy outcome of parenthood with a healthy relationship, because the relationship of today is going to set examples for the generations of future. I would like to end my presentation with a unfortunate situation. It is a real life situation of a 28-year-old doctor who got married to a surgeon after knowing him for a few months. After some time, allegations started of female sexual dysfunction, went on in a very ugly battle, ending with a divorce. However, during this period on gynecological examination, the examination was apparently normal, and it was blamed that she has situational vaginismus. Eventually, they were separated. She moved to a different city, moved on in her relationship, to discover that she did not have any FSD. It was actually her ex-husband who was suffering from erectile dysfunction. Probably couple counseling together and separately, and both partner evaluation might have saved the day. So these are some of my references other than the ones that I had quoted earlier. And last but not the least, I humbly seek your vote and support as I contest for the post of chairperson, Foxy Quiz Committee. With that, I come to the end of my presentation. Thank you so much for patient listening.
Thank you, Dipti. It was awesome presentation. You covered everything. So it is very important whenever a patient coming for infertility to take all detailed sexual history, and for both the couple, it is husband and wife should sit together. And I think sex education is very important part. And in spite of going in for investigation, that history is very important. And you rightly said that environmental factors playing important role. And this is the, I think Foxy leaders have bring up this new committee that is very important to, which is having association with so many things, and particularly infertility and sexuality. It is really associated with it. So you have covered nicely everything. Thank you so much.
Thank you, ma'am, and best wishes to everyone.
Yeah, so I am so sorry, Dipti.
Yes, sir.
Something distracted me and I missed your name. I just put at the starting, so I waited for the end of your topic. Your slides were very nice, by the way.
Thank you, sir.
I must say that. I have seen so many presentations, but your slides were very to the point and very nice. So
Thank
I
you, sir.
wish from all of us, best luck to you again, along with all the 5 contestants. So you are for sure a winner of quiz committee because you are working for it since so many years. Okay.
Thank you so much, sir. Thank you for the appreciation and blessing.
Yeah.
Thanks.
It was nice
Good evening, Girish,
presentation.
sir. Good evening, Sudha Tandon, ma'am, Poonam, ma'am.
Yeah.
Thank you, Madan, sir.
Good evening.
Yeah.
Good evening, everyone.
Good evening, Arun. You're very good present.
Thank you, madam. Thank you.
Okay, Dr. Rashmi, would you like to add something?
Yes, no, that was a very absolutely in-depth and very detailed and very nice talk, Dipti. All the best from all of us for your all future endeavors.
Thank you, dear ma'am. Thank you.
Yeah, thank you. Parul, are you there?
Yes, sir.
Yeah, we will move on to second session.
Congratulations, Deepti ma'am. It was a wonderful presentation. And yes, I would agree that your slides were really amazing and very crisp and to the point.
Thank you, Parul.
Moving on to our second session. It is sexual issues in perimenopausal period. I would like to invite the chairpersons, Dr. Varsha Lahade ma'am and Dr. Nibha ma'am. Dr. Varsha Lahade ma'am is a civil surgeon at Nandurbar, Maharashtra. She is the director of Prayag Hospital, Nashik. She is the past president of Nashik OBGY Society, past zonal coordinator for Amogs, past chairperson of Ethics and Medical Legal Committee Amogs, state coordinator Amogs, past joint secretary of IMA. She has so many awards to her kitty. The awardee of Best Paper Presentation in Amogs 2004, Sri Shakti Award at Jalgaon, Abhiman Maharashtra Cha Puruskar, V for Stree Puruskar, member of Adolescent Committee and Family Planning Committee, Foxy. Ma'am, we are in awe of your aura and we wholeheartedly welcome you here, ma'am.
Thank you so much, Parul. It was indeed a great introduction. And you can introduce Dr. Nibha.
Yes, ma'am. I would like to invite the second chairperson for the session number 2, Dr. Nibha Mohan, ma'am. She's the consultant at Renu Maternity Center, Patna. She's the treasurer for Patna OBGY Society. She's been the member of Adolescent Health Committee, Foxy, joint secretary, Patna in the year 2021-22. She has been the vice president for Patna Menopause Society, news bulletin editor for Isopar, clinical secretary for SOFSI Bihar and Jharkhand chapter, member Foxy.
Thank you, Parul. We can move ahead with
all
the
have so much to, just introduce you all. I wholeheartedly welcome you, ma'am.
Thank you so much, Parul.
And I would like to welcome our speaker for today, and I would like the chairperson to introduce Dr. Poonam Mishra, ma'am.
Yeah, good evening, everyone. Respected Amogs President, Dr. Kurtukoti, Dr. Parag Beniwale, Dr. Ajay Mane, Dr. Sunita Dandurwalkar, a great leader of Foxy, as well as everyone, all these chairpersons, my dear friends, and It's my pleasure to introduce this fantastic lady, Poonam Mishra. I've heard her, and you cannot blink an eye if you start hearing her. She's a wonderful relator. She's also a director of Manas Hospital and a secretary of Manas Seva Samsthan. She's a president of Indian School of Aesthetic Gynecology. She's a chairperson of Cosmetic Gynecology. She's a member of Sexual Medicine Committee, Foxy India. And she has done her fellowship in aesthetic medicine, cosmetic gynecology, and stem cell and regenerative medicine. She's practicing obstetrician as well as gynecologist and infertility specialist. The special interest of cosmetic gynecology, anti-aging medicine, and female sexual health. She was also she has organized and participated in many national and international faculty. And Dr. Poonam Mishra, I love your appearance and your presentation. The dais is yours.
Thank you so much, ma'am. Thank you for this generous introduction. And I'm blessed to have such senior and such wonderful chairpersons with me. And I'm extending my heartfelt thanks to Dr. Madan, Dr. Parul, best wishes. You are the charming, upcoming one. We need such talented people like you. And a very good evening, a warm good evening to our president, Dr. Sunita ma'am, Ajay Mane sir, aapko namaskar, Lucknow se, and to Dr. Girish Mane, Dr. Parag sir, Ameya, Dr. Ameya, everyone present, Dr. Brajbal, I can see you. So I'm going to speak upon the topic. Yes, it was very important one. And as Dr. Madan said that it should cover the both partners. Like male and female, we have to touch both aspects, though the heading has been given as perimenopausal sexual problems. So the problems are actually of the older couples, the couples who are now moving towards the geriatrics. So I'm sharing my slide for that. And yes, I would like to touch, because after the excellent presentation of Dr. Deepti, few things are only remaining. She has touched every point. So I would be touching the untouched sexual problems of perimenopausal couples. So my slides are visible. Okay, should I go ahead?
Yes, please.
Okay. Yes. Thank you. So the sexual issues in perimenopausal period of couples, both the couples I'm going to touch. So the sexuality wheel is, just a minute, right? The sexuality wheel, you can see, is involving the main part. Sexuality is actually governed by the body, thoughts and feelings, gender, relationships between those two couples, those partners, values and beliefs also, and what kind of situation they are living. And all are intermingled and they make sexuality. You can very well see over here, age is not a power. Nowhere it is written that age also matters. So age never matters. Things which affect the sexuality part are only these. So if everything is perfect, sexuality too is perfect in that age also. And the sexuality, the reproductive life of a female, because we are going to talk about the perimenopausal females, is menarche, menstruation, and then going towards the menopause. So once a lady reaches that age group, she is reaching the menopause, or she has reached, or she has passed, and now she is a menopausal woman, and post-menopausal age comes, the whole thinking, thoughts, everything changes. The society also changes towards them. Just a minute, I think. And they become the couple, the older couples, they become only the asexual keepers of the knowledge and the social mores. So they are now the persons who are going to take care of the family, take care of the kids, and just to tell stories and other things like the family matters. Now, their sexuality is not to be given importance according to the other members of the family. So this is the thinking towards which we are actually progressing once the age progresses. And what is the attitude? The idea of sexuality in late life has been denied by the society, regarded with humor. Many times the jokes are being made. People think that ye is umar mein ye hal hai. Umar to dekho apni paun kabar mein hai. This types. Now ghar mein bahu aa gayi hai. And perimenopausal age is that age. Once a lady is reaching 40, after 45, reaching 50s, going to attain the menopause. And at that time, the boy in the family is getting older, is going to get married. So now she's becoming a mother-in-law. She's having a daughter-in-law in the family. And now she has to take care of the sexuality of her children. How can she think about her sexuality? So this is the thinking of the society. And the lady and the man, the older man also thinks in that way. Sometimes what happens, they leave their bedroom for the newer couple, because those small families which are not having number of bedrooms, the privacy for the newer couple. So what happens, the father and the mother, they leave their bedroom for the newer couple. And now they are going to lose their privacy, lose their sexuality. And they don't have to think about the sexuality part because they are getting older. Disgust also is there. So denial of sexuality in parents and grandparents become denial of sexuality in all older individuals. This is the thinking. And many organizations are coming with the fact, they are giving the challenge that older adults are and continue to be sexually active with past the arbitrary cutoff of 60 years. In fact, up to the end of life, there is no arbitrary cutoff that their sexuality is now ending up. Think about the male or think about the female. Sexuality is going to remain over there, and we have to think about that sexuality wheel only. What matters is relationship. What matters is social beliefs. Yes, they affect a bit, but what matters is the coziness between the couple. And the atmosphere around them is going to cause a lot of things. That is why in the sexuality education, when we are telling the kids and telling the growing babies, the kids in the family and those who are going to get married, they have to be given the sexuality education for their sexual life. At that same time, we have to tell them that in their family, the older couples are to be given proper respect, proper privacy, and proper coziness to that couple also. They are not going to lose their everything, the respect in the family in the form that now they are the older ones. And revolutions have come in the form of hormone replacement therapy and the treatment of ED in male partner. So sexual behaviors in late life. Now the person and the couple is reaching towards the andropause and the menopause. Middle-aged, older individuals continue to be sexually active. This is the fact. Modest decrease in sexual activity. Older men are sexually more active than older women. Yes, maybe some psychological pressure could be the fact. Otherwise, nothing. Estrogen is missing. Estrogen is to be supplemented in the form of chatting. So individuals with steady partners are more active than the single individuals who have lost their partners and other ones in the family. The loving atmosphere is not there. So the National Social Life, Health and Aging Project has come up with the fact that 45 plus persons, they remain sexually active. And between 45 to 59, 84% of males and 78% of females are sexually active. And even in the older ones, 75 plus, 58% males and 21% of females. Yes, females become less active because of some other problems. So, and what is the frequency? This has also been given that once a week is the frequency in older couples. Now, again, the frequency becomes lesser, but sexual activity is there. Masturbation is also there. Men majority is having more sexual pleasures with them, and females up to 77% are, yes, they are also active, but yes, they are suppressed a bit. Is it important that masturbation, 60% males say yes, and 35% females also accept that yes, they make them peaceful, they make them mentally at peace, and they are happy in their family if they are masturbating. So this is also to be, to be addressed, to be talked about among females, because we as the doctors are shy. We as the doctors are not talking about this, even in younger ones. So where we are going to talk about in the older females. And the sexual response cycle again is the same: the desire, excitement, and arousal, the stage of plateau, the stage of orgasm, and stage of resolution is the same for the older couples also, the perimenopausal ones also, the andropausal mains also. But yes, that may take a bit longer time, all these stages. So the females with perimenopausal age groups, they come with vaginal dryness and genitourinary symptoms. They actually start settling down, and there could be the atrophy of urogenital tissues, decreased vaginal size, decreased vaginal lubrication, decreased erotic sensitivity of nipples, clitoris, vulval tissue, decreased sexual desire, decreased time to sexual arousal. So there needs patience, they need coziness, they need private space for longer time, they need their own space in the family as they used to have during their younger age. And they also have, the females, hot flushes, head, neck aches, excess fatigue, mood changes, decreased libido. And that decreased libido again is causing a lot of problems. Vaginal discomfort, they are not feeling emotionally interested, they're not feeling attractive, low self-esteem is there now prevailing, and relationship difficulties they arise. They are feeling tired, they feeling low. So this is something where both the couples have to understand the problem, and the whole family should understand. What happens? Saas bahu ke jhagde, saas bahu wala atmosphere jo family mein hota hai. That is the reason, because now she is becoming menopausal, she is having mood swings, she is becoming more irritable, she is having hot flushes, pain all over the body, less interest in everything. And the newer one in the family is coming, and she has to adjust with her also. She has to hand over every kind of reign of hers to the daughter-in-law. So that is actually something which has to be discussed in every family. In case of men also, aging men, there is decreased anticipatory arousal. They take more time in physical stimulation. Erection also becomes less frequent, less durable, less reliable, and volume of ejaculate is also decreased. So what happens? It's a vicious circle. The low self-esteem actually is taking place, is now thinking. The male also thinks that something is not. Now the performance anxiety, as Dr. Deepti also told about, the performance anxiety, that also worsens with age. Now the male thinks that he's not able to perform, and now this is going to give a bad impression to my female, that now I am aging and now I am losing my potency. So this kind of refractory period in older men varies from hours to days, and young people, it is for minutes sometimes. They get the space and they are done. So attitudes and internalization is also there. Overreaction to normal changes, mother-in-law feeling, decreased sexual activity, lose self-confidence, feels less sexy, feel it is inappropriate, harmful. I shouldn't be indulged in these activities now. I am aging. But what are the positive sides of aging? There are positive sides also. There is decreased responsibility towards children. Emptiness syndrome is there, but they are taking advantages of that also. Decreased anxiety. There would not be any chance of pregnancy. So their sexual activity actually is going to be more pleasurable. They have to understand that. Sexuality is a long-term care. It needs privacy for couples, facilitate conjugal home visits, do not disturb signs should be there. Yes, in the senior persons are there in the room, that doesn't mean one has to enter into the room without knocking. They have to take the permission. They could be in some conjugal pose. There could be some intimate pose, and there should be knock before enter. There should be grooming facilities also for these older couples. And sexual dysfunction in late lives are there. Yes, males are suffering. 50% males are suffering in cases of 40 to 70 years time period. Women are also suffering from multiple sexual dysfunctions. 39% females have been reported, but it is the underestimation actually. inhibited orgasm is there, dyspareunia is there, and the physician fails to ask about sexual function, and thus it remains untreated because nobody starts asking directly. Directed questions are never there. If the patient comes with all her sexual problems, if she wants some treatment, if he wants some treatment, he has to reach the doctor. If she has come with vaginal problems, dryness, and if she has come with intractable vulvovaginitis, dyspareunia sort of thing, so we have to go into detail about her sexual problems also. Sexual dysfunction in late life in males, more than like they have become andropause is there, now they are becoming more aging is there. So there is psychiatric problems also. Anxiety, depression, psychosis is there. Substance abuse could be there. Fear of death is always there. If I'm going to be indulged into that, I would be having some heart attack. I should refrain from such activities. Sensitivity to loss of physical appearance also. They also feel that they are not attractive at that time. They have to, they lose the control over their bodily functions. They also suffer from incontinences. And the life stressors are there. Loss of loved one could be there. Divorces are there. Financial and occupational stressors could be there, precipitated. And major health issues are there with them. Now everything is precipitating. Age is advancing and more of these medical problems also are precipitating. So the sexual dysfunctions, they start appearing in the form of like major risk factors in the form of diabetes mellitus, peripheral vascular diseases are there. So the ED, as everyone knows, that ED is there, something happening to the heart also. The patient is having some heart problems. If the male is coming to you with the ED, erectile dysfunction, go straight towards all the investigations related to the heart, because he can be a patient of, and there could be something hidden also. CA, pulmonary disease, stroke, dementia, Parkinson's. Primary effects could be DMCVD. Secondary effects could be fatigue, pain, disability. Medications like beta blockers and diuretics are there, and they have also got side effects. So all the medications, they are now upon that, and they are causing some sexual dysfunctions also. So assessment by the doctor. Now it is our duty. If the female is reporting to us, sometimes the male partner also, the female asks that, ma'am, इनसे बात कर लीजिए, इनको भी कुछ दिक्कतें हो रही है, या इन्हें समझा दीजिए. He shouldn't poke me. Now he wants the sexual activity and I am having pain. So there the female has also to understand that she needs treatment, and the male has also to understand that now he is aging and the female is also aging. He should not have some unusual sort of expectations from the female. So sexual history to be taken, prior sexual experiences, what they are suffering from, current sexual functioning, what kind of coziness is there, attitude towards sexuality. It is also to be understood. You are now explaining everything towards them and they are now thinking that क्या डॉक्टर को हो गया, हम तो यहाँ बीमारी के लिए आए थे और ये हमें sex पढ़ा रहा है. So you have to understand that also, an attitude towards any partner. What kind of sexuality feeling is there, and now you have to go ahead if they want, and if they don't want also, you have to counsel them. Doctor-patient relationship also matters, partner involvement, medical workup, including physical examination, routine investigations are to be done, special diagnostic tests to be done. And if direct sexual problems are there, you have to go for the nocturnal penile and penile duplex USG if the male is suffering. So treatment could be the education, the reassurance, sexuality education. Sexuality education is the major thing. Major thing for the younger couples, major thing for the older couples also. Shift focus from intercourse to foreplay. Now the intimacy matters. Maximize rehabilitation and palliative treatment. Analgesics are to be provided generously. Inhalers, if there is shortness of breath, some asthmatic part is also to be ruled out. Physiotherapy for joints and muscles. And you have to treat the depression and anxiety psychosis also. Medication side effects are to be discussed. Wait for the tolerance, decrease the dose, alternative regimen, drug holidays also should be given to the patients because drugs also have got side effects. Some antidepressants the patients are taking can also precipitate ED, erectile dysfunction. So you have to know about the antidotes. You have to know about the plan B. Sex therapy to be given to both the partners in the form of brief educational supportive counselings, intensive couple therapy, cognitive therapy, sensate focus. Many type of therapies are there and they have to be given to the patient. You have to take help of your psychiatric friend also, the psychiatrist friend, the psycho. If you are having some psychotherapist, psychoanalyst with you as a counselor, take the help of that person. Distorted attitude, practical attitude, catastrophic thinking that if I don't achieve erection, I will be rejected by the partner. This kind of thing is to be addressed. All or nothing thinking, I must achieve instant erection or the whole thing is going to be the pointless. Replace negative thoughts with a realistic, hopeful statement. Affirmation of success is to do. The couple has to be reassured. Relation techniques with non-pressured sensual touching, gradual progression to genital stimulation, intercourse. This has to be told them. Now you are the aging couples. You need more time. The refractory time is going to be more between you two. So give more time. Be patient. I'm not going into detail because Dr. Deepti has also touched these things. Erectile dysfunction, how you are going to treat premature ejaculation is something which actually suddenly appears. Many couples come in our OPD that the geriatric part, those who are attaining menopausal clinics, they tell that now the husband is attaining the erection, but he loses very fast. So squeeze, start, stop technique has to be told to them, and some treatment. Take the help of your sexologist friend. Hypoactive sexual desire disorder in females is their poor self-image, negative society attitude towards sex education and counseling is a must. Estrogen replacement therapy. Something is missing, something has to be replaced. Testosterone replacement and sildenafil and other that group drugs. Female orgasmic disorders are there. And me being a cosmetic gynecologist, I always take the advantage of PRP therapy, of lasers, of rejuvenational therapies for the vagina and vulva. And yes, patients are coming back. They are coming in my OPD and they are asking, ma'am, ek baar aur shot de dijiye. It was good. Everything was perfect. Now I was not that dry. So masturbation with vibrator, increased clitoral stimulation, this has to be told to the female, and they have to be told that they shouldn't feel shy. They have to get the sexual pleasure, though they are now advancing with age. Dyspareunia has to be taken care of because this is something which actually appears once there is more of the females are coming in their menopausal age, that now we are having sexual activity and we are having cuts and bruises. I feel a lot of pain. So there you have to take care of everything. The vulvitis and medical conditions are to be treated. OBGYN opinion, estrogen replacement therapy, sensual excess, massage, foreplay, oral sex, all these have to be explained to the patient. Positive attitude, optimal health, no tobacco, alcohol, communication with partner, foreplay, treat the medical problems is the doctor's part. And before sex, they have to take painkillers also and inhalers if needed. Females have to apply estrogen, cream, something. They shouldn't be shy about that. Identify the problematic medication, avoid unrealistic expectations, and explore positions also where they are attaining. And this has to be understood by everyone, by the patient and the doctor also, that sex is not the penetrative one only. Sex is coziness, sex is intimacy. Sex is being together. This is something which has to be explained to the patient as well as in our medical fraternity. Also, this kind of awareness is to be actually raised because we are treating our patients and we are actually encountering such aging couples. So age is just a number. A 60-year-old woman is now being crowned with Miss Universe. Taj uske mila hai. So something is there. Age is just a number. And yes, the perimenopausal age is not a bar for many activities, for beauty, for sex, or for all the positive attitudes. Okay. So the mind's first step is to self-awareness must be through the body. Thank you so much.
Yeah, Dr. Poonam, it was really an sensuous presentation with your emotions and expressions. Wonderful and very comprehensive. I loved it.
Thank you
you
so
so much, Varsha ma'am.
Yes, it was really a wonderful presentation. At the outset, let me thank the wonderful Amogs group, the charming president, secretary, everyone, with such a bright confidence and with the president, secretary, Dr. Madan, Dr. Rashmi, everyone, and the wonderful chief guest of today, Dr. Sunita, and guest of honor, Dr. Ajay Mane, Girish Mane, sir, Dr. Purandre Parag Benewala, everyone, and the wonderful presenter of today, Dr. Poonam Mishra. We had some interaction in Safe Motherhood Committee group, I think, but I heard today for the
Yes.
first time, it was really wonderful. The way of presentation, your topic, your content, everything was so good. And the topic, the sexual problem in perimenopause, such a common problem with the increasing life expectancy. We have a large group of the patients with this problem, and we are really going to sort out this problem with not only with the deprivation of estrogen. Earlier, we used to provide them like local presentation and like local drugs. Now with aesthetic gynecology, we have so much to do to improve their sexual problem, like dry vagina and difficult intercourse and everything you are going to improve. So they have got all the opportunity with the improved sexual function. We are always there, like if Dr. like Poonam Mishra is there to help them out. They are really happy in their life with all their sexual problems. So thank you, Dr. Poonam, for covering all the aspects so beautifully. So thank you, everyone, and thank you, Amogs Society, for this opportunity for being made here. Thank you.
And thank you, Dr. Madan, for having trust in me. Thank you.
Thank
so
you, Poonam
much.
ma'am. It was really super presentation, really, by content and presentation.
Poonam
also.
ma'am, as always, you were just fabulous. Just
And
fabulous.
thank
You
Parul
just
also.
nailed it.
Thank you, Parul, for your evergreen sweet smile. I must say, a smile to
I think I
you.
really need to show this recorded session to my husband, that he really starts appreciating my smile as much as other gynecologists do.
Okay, that was too good.
Thank you, Varsha ma'am and Nipa ma'am, for joining.
Thank you. Thank you, Dr. Madan, for everything.
Yes, thank you. Let us
I can
move
see
on
Dr.
to
Sita ma'am. Namaste.
our last session, which is the panel discussion.
Say, Poonam.
Today's topic of panel discussion is something different. We have thought how to be non-judgmental dealing in the psychosexual issues in our day-to-day practice or our clinical practice. And we are so lucky to have the esteemed panelists or experts in the field of psychosexual medicine. Dr. Narendra Malhotra sir, but unfortunately he's not joining today. He's not feeling well. Just received a call from him. Dr. Girish Mane sir, Dr. Sudha Tandon madam, Dr. Deepa Mukundan madam, Dr. Sita Lakshmi madam from Thrissur, Kerala. I would invite Dr. Parul to introduce our experts of today.
The first
Parul.
panelist for today is Dr. Girish Mane sir, who has been the past president of Yavatmal OBGY Society. He's the past chairperson of Adolescent Health Committee, Foxy, from 2019 to 22. He has been the past chairperson for Adolescent Gynec Committee in Amogs. And sir has been awarded the best chairperson.
Parul, thank you. Next, please.
We welcome you, Girish sir.
Thank you very much.
The next on board is the very vibrant Dr. Sudha Tandon ma'am. As her logo and her line, which is written very rightly, inspired by purpose, driven by passion. She's the secretary for IAG 2024-25.
I think you can skip this, please. Let's go.
Yeah, welcome you, ma'am.
Thank
Welcome.
you so much. Yeah, thank you.
The next on board is Dr. Deepa Mukaddan, and she's the National Coordinator and Executive Committee Member for Midlife Management Committee, FOXY, and she's the Consultant Obstetrician and Gynecologist Endoscopic Surgeon at Assured Best Care Hospital, Trichy. We welcome you, ma'am.
Sorry to, yeah, thank you. Thanks for being short.
Yeah. And we welcome our another panelist, Dr. Sita Lakshmi ma'am, who's a gynecologist and sexual medicine practitioner. She's the pioneer of a successful, transformative, novel, holistic inpatient batch therapy for couples struggling with unconsummated marriage and other psychosexual dysfunctions. She's been a public speaker on Doordarshan, Josh Talks, and she's been a wellness relationship coach and has been practicing hypnotherapy also. She's been having a lot of affiliations and is the director at Dr. Sita's Mind Body Care Devi Kripa Hospital, Thrissur, Kerala. We welcome you, ma'am. So while me and Madan sir, we were talking over the phone over just a random conversation, and we just had this thought that why not keep a panel which is a little different than what we keep discussing all the time, that how do we practice being non-judgmental, especially when it comes to psychosexual issues which the patients pop into us. And whenever a patient who comes in with such a desire or problem, they always want that they are heard, they are seen, and they want us to have a conversation rather than a consultation. And they want us to hear it absolutely non-judgmentally. So here we are bringing up all the situations and questions which, the patients might just ask us. And let's see how do we put it across to them and how are we non-judgmental whenever such an issue erupts. So starting with our panel, I would request Dr. Deepa ma'am to answer our first question for this panel today. What do you think that, the psychosexual problems can be which a couple encounters in their relationship in midlife period, especially when the children are very well grown?
First of all, a big thank you to Dr. Madan and Team Amogs for having me on board on this wonderful, mind-boggling webinar today. I think I thoroughly enjoyed the previous two talks. I think they've already covered a lot of things, and I'm so happy to be here in the panel. And my respects to Dr. Sunita ma'am, Dr. Parag sir, Dr. Ajay Mane sir, and all the chairpersons and the Team Amogs as well. Going to the question. Well, midlife is somewhere between 35 to 60, right? So this is the time when everybody peaks in their career and their life is full of stressors, different kinds of stressors. It can be like children are growing up, their education has to be taken care of, their marriages, then the financial stressors, their financial goals need to be met, and they are very busy in their everyday work life, and there has to be a good work-life balance. And, so which is why both men and women, actually, they probably have less interest in sex. They don't have time for sex. They're probably not spending enough time with the spouse. So that's one big thing. According to me, mind is the biggest sex organ. So if the mind is ridden with all kinds of stressors, where is the time to think about sex? People don't even think about it in the first place. And then to top it all, there is this fear of pregnancy, and then like with grown-up children. So they feel ashamed of getting pregnant as well. So I don't know how many of you have seen this movie called Bro Daddy? Have anybody seen that?
Yeah.
It's a wonderful movie, has to be seen in Malayalam, where the father is having a daughter-in-law who's pregnant, and mother is also pregnant at the same time. I mean, like, father's wife is pregnant, son's wife is pregnant. So at the same time. So it's a wonderful, hilarious movie. They've taken it very beautifully, seeing that the mother also carries the pregnancy to term. So that's how it is. We shouldn't be shy of getting pregnant or getting treated for that, or getting MTP done in that age. So people have that thing in their head. It's a big mental block for them. Getting ashamed in front of grown-up children for getting pregnant or whatever. And in long-standing marriages, I think when it comes to midlife, the romance dies out for some time, for some reason, for many reasons. It's very important to keep the spark of romance going on, especially with a lot of things matter. The physical appearance might have changed. I think Dr. Poonam ma'am just fabulously explained everything. The physical appearance changes, the interest in the other person changes, their mind is all somewhere else. And also midlife is a period when a lot of non-communicable diseases manifest. People can have diabetes, they can have hyperlipidemias, they can have hypertension. They may be on a lot of drugs as well that can take a toll on the sex libido as well as the performance aspect, like anti-diabetic agents, etc. And coming to women, very often menopause is approaching and all the problems that come with menopause. There is this estrogen deficiency, so the libido is less, there is dyspareunia, there is dryness, there is recurrent UTIs, and they probably don't end up enjoying sex as much like before. And so these are all problems that can arise in midlife. And in fact, a lot of these, in fact, commonly one partner is active and the other partner, usually the males, males are active and the other partner is not so active because of the menopause and all those mood changes and all that. So that's when marital disharmony is one more big thing. So these are all the problems that we can encounter in midlife in a nutshell, and so these have to be addressed.
I would like Sudha ma'am to add to this.
I think she has really very beautifully put. But I think one thing which is something new and which is not new, but which is cropped up or come into everyone's life in a very big way is the cell phones and laptops.
Agreed.
That is, I always feel as though everybody's got married to the cell phones and the laptops,
However hard we try to put the cell phones aside, it's like a 5-minute conversation and again we are back to the cell phones.
Again, we are back. It's an addiction. It's an addiction. How much ever it could be valid. It could be meaning you're looking into something which is really important. But at the same time, I feel realistically speaking, it has invaded everybody's privacy in a big way. And I don't know what's going to be the end of it, but the privacy has really got invaded. I mean, even in the sleep, just getting to bed, still how many likes they have got, so various things. So I think that is one big issue that we need to control. We need to, as an individual, decide, okay, now I'm going to not look into this. Is what I personally feel. I don't know whether it is practical, not practical, but
absolutely,
it's something which we really need to look at.
Yes, you're right, ma'am.
Absolutely,
And one
ma'am.
thing,
Absolutely true.
many times there is a small house, they couldn't get privacy, and the children are growing. There is difficulty in making love also.
Madam, one very important again point that immediately after
Yes.
marriage, sexuality is the common interest in the couple, but the responsibilities are totally different. So one person cannot, cannot be that kind of, or that, that may not be like enough grown up that to know about the responsibility of each other. And that is the reason why the responsibility overpowers the sexual attraction in the later life. And the common thing which was among that couple, sexuality, they both explore simultaneously, but the responsibilities which are totally different for both the spouses, they are supposed to handle individually, and probably that overpowers the other things.
Yes, absolutely, sir. Yeah.
That was very
Yeah, next.
enlightening, sir. Agreed to that point. Absolutely. The responsibility sharing probably changes the way, women or a man would or might feel towards sexual inclination and things like that.
So correct.
Yes.
Yeah, that's why I said
think
like
we
the mind
have
is
to
the
have
biggest
those-
sexual organ, and if the mind is not free, then you're not going to be inclined. Sorry for
And
interrupting.
I would just say that, in US, they have started having social media de-addiction centers. Very soon in India also, we would want to have something like that, because really cell phones are taking a lot of, I think whenever you enter in your bedroom, it's never that you're looking at each other, you're looking into your cell phones.
But
So I think that's
don't you
also
agree with
one
me
big.
that before cell phone also the situation was almost same, because it has relation directly to the age or responsibility probably. Cell phone
Yes,
is
sir,
one
but
of the criteria.
yes, because now I think when it's a nuclear family, the kids have their own bedrooms, the parents have their own bedrooms. Still, because of cell phones, the privacy is no longer privacy. I mean, it's more towards, using their cell phones and things like that in the present generation, at least.
In fact, cell phone is the answer for their, I mean, multi-directional faces after some age.
Yeah.
Madan sir,
You
the
need
next
to
question.
We'll move on. Yeah.
I'm sorry.
It's nice inputs.
That can be the topic.
Yeah. Next question is for Dr. Sita Lakshmi. When a 21-year-old girl talks about her partners and premarital sex, how will you take it and how will you proceed further?
Okay, thank you for the question. Thank you, Dr. Madan and Team Amogs for having me here, and my respectful regards to Dr. Sunita ma'am and all the chairpersons. So coming to your question, this is something which is to be done in a very sensitive manner. Though in our country, traditionally premarital sex has been considered as a taboo, these days many men and women are indulging in it, and they don't even blink their eyes when they tell you about it. So it is very important to be non-judgmental. So if a 21-year-old girl comes to me like this, then I would make sure that she is able to open up to me first by providing a comfortable and safe environment, ensuring privacy. Sending out the staff is very important because many times the staff are here taking BP or doing something or doing some paperwork. Then the girl is not going to be comfortable at all. Send out the staff, make sure we are not interrupted often during the consultation. Active listening is very, very important. Body language and facial expression is also very important because if she feels she's being judged, then she'll close up. And unless she opens up, how can I guide her? So it's not possible, no? So we'll have to consciously do that because sometimes inadvertently our facial expressions can change. And these girls, they will be on the lookout for that. If she fumbles in between, yes, she's sure to do that. I'll reassure her that it's okay to share all her concerns, and I'll make her feel relaxed, and that I'll ensure the conversation will be kept confidential, and I'll be totally non-judgmental. So I think it's okay and it's needed if we tell her or we reassure the person that yes, we will be non-judgmental. It's not just our attitude and our demeanor. We can tell her also, at least in this age, I think that will help a lot. That's what I've understood by consulting many patients. Okay. And in case I'm tempted to give suggestions, I'll hold my tongue. If needed, I'll bite on it also because sometimes we are prone to give suggestions. No. So we have to keep ourselves from doing that. And after listening to her and validating her concerns then only we should ask what she has come to us for. Whether she wants suggestions, whether she is worried about anything. Because in between, if we have this habit of trying to finish off with each patient in a very fast manner. So at least with such girls, we have to be very, very careful. So by the time she would be more comfortable if we are listening to her actively. And then only we can slowly, I'll start discussing about safe sexual practices, importance of preventing pregnancy, importance of preventing STI. Many people do not have any idea. They think that condoms will prevent STI, but it's not like that. So we have to explain to her about all that. And we have to take care at all times not to sound preaching because youngsters these days, they don't like it at all. I realized that after seeing so many unmarried men and women who come to me for consultation. So if you sound at least a little preachy, then no, they are completely closed off. And in between, I'll ask open-ended questions also to understand our feelings and experiences. Many times, it's not actually per se sex that they need. They want some emotional attachment to someone, And then what happens is there's a sort of bargain. So if she is in love with a man and then the man tells her, okay, if you really love me, then you'll allow for premarital sex. So then actually it is not for sex. Many a times the girls go for, that's what I have felt. They want such that emotional attachment. They want that caring, somebody to care for them. So it's better that we ask them
What do you value most in your relationship? How do you want your partners to make you feel about yourself? Such questions, such similar questions, if you ask them, then they'll be able to think for themselves rather than us telling them, you do like this, you don't do like this, your partner will be thinking like this and that. If we just give them open-ended questions and make them think for themselves, I think that will be better. And we should encourage her to think about the potential consequences of her actions and decisions in the relationship. Because we cannot say that you should do that, you should do this. So if you say like that, no young girl is going to listen, not even young women. I think nobody is going to listen if we talk like that. So we can just help them to make more informed choices, isn't it? And it's better that if she has got some emotional issues, some anxiety related issues or some other issues, then it's better to refer her to a counselor or therapist also. Ultimately, what I realized it is very important not to preach.
Okay.
I hope that the panel agrees with me.
The main issue is we have to maintain the privacy and confidentiality of each and every patient. And as she is a major girl, she is not minor. Then she has full right to enjoy her sexual life.
Yes.
We cannot interfere much.
Yes. But the problem is many youngsters, they say that we know everything, but then they don't know anything about consent. They don't know anything about that is invading privacy. They don't know about the STIs and all that. Pregnancy, yes, they may be able to prevent, but other things, it's very difficult. And the emotional investment on a relationship, the hardships that happen, all things can
I think we have to give advice, for what she has come and what she demands from us only.
Yes, that is what. So for that, we have to
If she has
keep
come for
listening.
contraception, otherwise we can that only.
Sita ma'am, do you ever expect them to get their boyfriends also along? Because
not really. I don't know whether they will bring the boyfriends also.
Do you ever encourage that if suppose say there is an emotional turmoil or safe sex practices or any of that, if she comes into you for talking about premarital sex and things?
Yes, if
you encourage her to get her boyfriend the next time or her partner the next time?
If they are willing, if they are open to that, yes.
So the ma'am, you want to add something to this?
If they're open, and some of them are really open to that also, some of them are open to, and I have this advantage because many patients come for consultation after watching many of my videos. So then by the time they come to me, they know that, okay, I'm non-judgmental, so they open up. So that is one advantage which I have. And yes, if they're open to bringing their boyfriends, definitely yes.
Ma'am, there is one question related to this. What is your opinion regarding this premarital sex, whether it is right or wrong? And does it have any impact on sexual relationship after the marriage?
Well, I think that is a purely subjective thing, I mean, you cannot say that it is right or wrong. It depends upon
We cannot decide.
cultural norms and personal values,
But does it affect the sexual relationship after marriage?
It has got potential negative impacts, and some studies say it has got a neutral
It may or may not be.
May or may not be. See, for some people, premarital sex can lead to emotional complications such as feelings of guilt, regret, or attachment issues. And that can then interfere with their marital relationship, especially if they are getting married to another person, and not the person with whom they have had premarital sex. And then
these days, that's the thing. I mean, that's the rule, I think, that the person whom they are involved with is not the person whom they get married to.
Mostly. So that is, but these days, many people consider all such sexual activities in a very casual manner. You're surprised to see that. And then sometimes what happens is previous sexual experiences might lead to comparisons or unrealistic expectations, especially if the person with whom that premarital sex was done is a better partner. And another thing is, before marriage, there is not much of expectation from the partner regarding other aspects of relationship. After the marriage, then you didn't do this for me, you didn't care for this, all such expectations come into play, and that will cause a mental discordancy, and that can lead to sexual issues also, no? So I think it's difficult to compare.
Madan sir, for any act, there is a possibility of only two effects, positive effects or negative effects. The premarital sexuality may, it may have negative effects, but it will never have positive effects. So if you compare, then probably marital sexual relationship is not at all, it's not it should not be done by everybody. Because see, anybody, sorry. Because if at all something will happen, it will happen only negative, either negative or neutral, but it can never have any positive aspect or positive effect on anybody's life. This is my personal opinion.
Yeah, but the thing is, if we counsel young girls and boys like that, they are not going to listen to you at all. So
But
we can't
look
do
into
anything.
the current scenario, either male or female,
Yeah.
if they are having enjoying the casual sex before marriage, they won't have any effect. If they are seriously involved
There
or
can
highly
be
emotional
comparison,
person,
there can be
So many people
there
consider
may
this just as a physical need. So they just don't even give
just
any
they enjoy
importance
the
to that. That is
premarital life.
uh,
They won't have any effect.
Can I just
Yes,
make a
yes.
point? Actually, now people are postponing marriages like anything. People don't want to, a lot of people say they want to get married only after 30s, 35. So how do you expect them to not have any kind of relationship for so long with all the media exposure and, so much happening around us? And I think it's very unrealistic to expect them to be like not
yeah.
having any.
Because
Madam,
sex
it's
is a
not a
primal
suggestion.
need.
It's
Sex
not a
is a primary
suggestion.
need.
It's a comparison. It's a comparison only.
Yeah.
It's not a suggestion.
So actually, like, we have to be very considerate when we
Correct.
look at them. They're having a very long single life. Those days, people were getting married so early, so their sexual needs were getting satisfied. But now that's not the case, right? So, and nowadays, I think this generation, they are very sorted. They know what they are doing. I think,
Yeah.
So
of course.
many a times they are
Can I
not
just
emotionally
add?
affected. Many a times they're not emotionally affected.
Exactly.
When the partner, they break off with the partner and marry someone else. They're not emotionally
Yeah.
affected.
Yeah.
In
So
fact, they
they've
become
learned
friends
to
with
accept
those
this as
people
the
also.
norm. They're,
Yeah, that is the most surprising thing. Yeah, they continue to.
But I think that does become such a common phenomena that they were dating somebody and now they have moved on. They have also moved on and now they both are married somewhere else and now they all are friends together. So I think
Yeah, this can
the
happen.
present generation has
so
the
it's moved
emotional
on to a,
quotient which is involved with all this is a little different, I must say. I mean, not right or wrong, but it's different. That's what we can just say. It's nothing right or wrong because it's that's what we're talking. We don't have to be judgmental of
We
any
can't
of
be
this.
Sudha
judgmental.
ma'am, want to say something? Sudha ma'am?
Yeah. Dr. Sita Lakshmi, right?
Yes, ma'am. Yes, ma'am.
Who was talking?
Yes, ma'am.
Yeah.
Yes, madam.
I'm honestly, you have thrown such good light on this topic, and you have really covered it very well. I can see there's so much of experience that you have,
Thank you,
and
ma'am.
yeah, and there are two things that we are discussing. One of 2021 age, and one a premarital sex. So I think the points that you made is not to be judgmental, be patient, give them time because they are not going to open up so soon.
Yes.
They are going to take time. I think that to make them feel confident in you that you're not going to be judgmental, you're not going to preach is very important for them to open up to anyone. So I think that is a very important point, whether it's your patient, your friend's child, or whoever it may be. But at the same time, it is important that by the time or when you are discussing or when you're finding out, you can just put some suggestions which are going to be right and relevant, and they may or may not like it, but it has to be told to them at may not be in the first sitting, maybe second or third sitting, but telling them the precautions that they need to take and the risks involved, and it can have repercussions because finally they may be very confident or super confident on the surface, but if you really scratch the surface and go to the bottom, they are actually scared. They actually want to get the right advice. There's so much of peer pressure on them that they want to behave like what they see on the television, what they read, and what their friends do. But they also have come to you for the right advice. So I think hats off to you. I was very impressed by the way you have taken this topic, and I think it was very, very relevant. Thank you so
Thank you,
much.
ma'am. Thank you, ma'am.
Yeah, Farul.
Yes,
Girish
yes.
sir. Girish sir, carry.
Yes, yes, yes. I think with all the new terminologies like breadcrumbing and all those things which they have, I mean, there's so much which, because I have cousins who are like in their 21, 22 era, and they just keep telling us, it's just breadcrumbing. And I'm like, what are you people talking? That we have no interest. It's just something casual to keep our sanity. And I'm like, seriously, is this what you people are looking forward to? But yes, that is what the generation is talking. And as Sudha ma'am has very rightly said, that yeah, not in the first, second, or third, but at least in the fourth, fifth conversation, we can guide them through that what exactly, because they've come for a professional advice. So yes, as a professional and being non-judgmental also, we need to tell them what is good for them and what is bad for them. Talking health basis, that is what we have to tell them. So coming to our
Can
next
I add a
question,
point? Actually,
and
like, sorry, can I just add a point?
yeah,
Yeah, please.
I've come across quite a few youngsters. I feel when they indulge in premarital sex, they don't feel the need to get married at all, unless they want children. The people who I have many people who have spoken to, they want to remain single because I think earlier years, premarital sex was not common, and people were inclined to get married and then have sex. Now it's all in the open. So I feel like it's a lot of the younger generation people, they want to remain single and have multiple partners and go ahead with.
They do not want any inhibitions and responsibilities of
Exactly.
getting
They don't want to
married
take
and things like that.
responsibilities. Exactly.
They
That's
still
what
have
I
the
was
perks
looking.
of being sexually involved.
Right. They don't want to get into a responsible relationship with anybody. So it's actually taking a bad toll on them.
Yes.
Especially in highly educated population, IT
Yes,
people.
yes.
This
They
is
are
happening.
worried about getting into a long-term relationship with anybody like marriage.
They don't
Actually,
want
that's what's happening.
responsibility.
No commitment, no
Yeah,
Don't want to
responsibility.
be
because they
pregnant.
feel they can't break away easily. So yeah, it has definitely some flip sides.
Yes.
Girish, sir, this
And
question.
I feel it has flip sides. We know about it, but I'm sure there is so much of conflict in families where the parents want them to get married, and so I think as much as the couple or the youngsters need advice, even the parents who are in their 60s, 50s, 60s, they have to be counseled because there's a lot of hell that they go through. What is this? And there's so much of stress. They have their own medical problems, that they have to bear. So they cannot just have a blind, or deaf ear to what's happening and chalta hai attitude. They cannot do that. So somewhere, subtly how to make them come into that commitment mode. It is a big challenge even for the parents, I feel.
So we are in that sandwich generation, ma'am. I think we are
Every
caught
generation
between the
thinks that
moralities
about
of
themselves, that they are in that
our next
sandwich generation.
yeah, because we are caught between
Yes, we are in the sandwich
uh,
generation.
parents as well as our children.
Parents.
Our
We
parents
are
say
going
this
through
for
a lot.
about us, ma'am,
Yes.
that we are that sandwich generation, the elder one, and you people. And we feel the same for the parents and the younger ones. So I think every time the people who are talking, they feel that they are the sandwich generation. And it's the two generations which they have to, deal with. So moving on to our next question, Girish Mane, sir, this is for you. When a girl talks about her inclination towards women, how do you think that you want to proceed? I mean, do you give that weird look? Seriously, are you talking about this? Or you want to take it very well? Yeah, that's normal. That's something which might just happen.
My answer for this question in the panel will be different and in the reality will be 101% different.
Oh.
Because I know I am
Good one.
the orthodox person, because I have done many times I have discussed this thing with many people, and most of the time I have lost it, because till now I am not ready to accept all these things. Unfortunately, I do agree with the feelings, everything. But what I think, every physiological structure and every physiology has been given by the nature for some specific reason. For example, the sexuality is probably it is for reproduction. So in my opinion, if the sexuality is in between a male and female, means nar and mada in every animal, then it's okay for me. But if any girl is having inclination towards any woman, then it is good on her part, but probably I am not in that way. I am wrong, I know, but I am not.
No, sir, we are not being judgmental towards you also.
I'm with you, Girish. I'm with you,
See, I
Girish.
am very
I'll be
clear
shocked
about
first
I
because
am very
I
clear
still
about it
haven't
because
You can
brought
have your
myself to
opinion,
I
accept
had
it.
a lot of
absolutely.
discussion regarding this with many people, especially with Parag Biniwale sir in Westin once time when I was adolescent chairperson. That time I used to skip many things from my talk and from the CMEs and everything. He used to ask me, why you are so judgmental? I said, I am never judgmental, but I don't want to talk on this subject because I don't want to spread any message which I don't like.
No,
Extremely
but
sorry, but this is my
Okay.
at this point, I would just, like to find out whether it is female or male. Have we really, interacted with them to see, or, because about 10 years back, when there were a lot of foreigners who were allowed to come for surrogacy here. So uh, I used to be totally against homosexuality.
Madam,
But
in
when I
this,
did surrogacy,
yes, please, please go on.
yes.
Yeah, go on, man, please.
Yeah. So when I interact, I did not accept cases for 2 years because I was of that opinion. And they said, if I don't accept anybody else, somebody else is going to accept it. And then when they came to me, I found them to be very nice people. But at the same time, I am at the stage where I don't know whether it is right or wrong. But have we talked to their children to know how they are feeling is something I think I have not come across. Any article or um, any child who will talk, okay, my parents are homosexual. So that's something which is still I have yet to find answers to it. But I found these people to be extremely warm and very good. And very typically, one of them is little bit subdued, and the other one is little bossy. And I find I've sort of now I'm in a position where I don't know whether it is right or wrong. I will not vehemently tell wrong or right because
Madam, you will
yeah.
surprised to know that in Yavatmal, such a
Yes.
small place, there was one marriage. I mean, boy got married with another boy from some other country legally in my place. And I know that family very personally. That marriage was before 7 to 8 years. You can go and find out on the Google. And now I know about the whole family. What is the scenario? Actually, that time, the family members, they were little bit, I mean, not very willingly, but everybody participated in that marriage and many things went on. A lot of discussions happened. कोई भी आता था बड़ी बड़ी बातें करके चले जाता था. Everything I have seen, and but now the condition is that family is totally, I mean, they are in trouble. I mean, they have shifted from Yatmal to some other places. See, what I want to tell, whenever there is I mean, little bit like a discussion on this subject, no, there are many points where you can make them valid. Why shouldn't they have right to choose their likings and everything? But practically saying, it's very difficult for society to accept all this relationship.
I agree.
When patient will come to my clinic, then I will never say nothing. I mean, I won't be judgmental for that pair or all these guys. But personally, I think
Yes. You're not comfortable at all.
yes.
Yes.
So I will refer that patient to Madan Kamble.
I have always thought, like Girish said, physiology, it's against physiology because male hormones are supposed to induce attraction towards females, and female hormones are supposed to induce attraction to the opposite sex. And how can it work otherwise? I'm still not clear. I'm always like having that question in my mind. So
Yeah.
I really can't accept
That
it.
happens, madam, and that happens on a very
Or is
large
it just a
scale.
fashion to say like I'm
Yes,
gay?
yes.
I don't know. It's just
Ma'am,
becoming
that's what,
fashion.
I mean, I have a friend, she got married to another girl and a very renowned family here in Nagpur. Her father used to be the dean of GMC. And we've been working for LGBTQ plus for a way that, this just to promote that they should have safe sex practices and things like that, but still there is so much that they are still struggling with. But at the same time, I've seen how happily the two of them and uncle are staying together. So it's very different, it's very difficult to understand for people who think straight. But I think for people who are in that particular zone, I think for them, it's something which is absolutely normal, and that is why they are going ahead with it.
Exactly.
Yeah.
And
When they are ready to fight with the whole universe for their likings, then they have to be, I mean, they will be definitely happy with what they are doing, no? Because whatever they are doing, it's with their choices.
Yeah, because I've seen them, sit down for that Supreme Court hearing when it was legalization of marriages in India and things like that. So I've seen that phase absolutely for them. So I've seen the kind of joy which it brings to them for, legalization, and that they can show their love, they can show their partner to the world, and they are no longer in that inhibition zone that, okay, yeah, this is my partner. They don't even like to say and pronounce that boyfriend and girlfriend. They want you should use terminologies like partners and things like that. And I think it'll take I think 2-3 decades for us to just have that normalization, because the way we have been brought up, we've been seeing a mother and a father. We have never seen two mothers or two fathers. That's
Actually, if I may add some points.
Absolutely.
Yes, madam, absolutely.
Yes.
So actually, I think that is the way the society normalizes it. In the ancient India, not only in India, in many parts of the world, there are many texts, there are many evidence to show that homosexuality was practiced and that was not condemned at all. See, for example, in Kama Sutra, a book by Vatsyayana, he has described homosexuality, both lesbianism and gay, and he has described techniques and he acknowledges the existence of lesbian relationship. And also in many of our temples, that is, architecture shows homosexual relationship. There is so many figurines where we can see. I think with the British colonial rule, they only made it into a big sin. Now, I think so. Now we have slowly, maybe we have to go back to our original this thing.
Recently, we
Sita
had this.
Sita madam, they are very rare examples. They are very rare examples. See, rarity is everywhere.
No, but where is it written?
No,
Where
but
is
it's
it
not a
written
common thing,
precisely that
madam.
a man should? Where is it written precisely? Of course, I am not for homosexuality. I'm not telling you that, but I'm just asking you, that is, where is it written that a man should be attracted only towards a woman?
That's
and a woman should
exactly
be
what I'm coming
attracted-
to, ma'am. That in AIMS, we recently had this workshop for LGBTQ+I, and it was with the psychiatry department out there. And this is what we have discussed. And there is one person who has actually enumerated all these things, what Sita ma'am is just telling us, that this has been in our ancient textbooks and everything. And it's after the British rule that these things have been put under IPC and things like that. Otherwise, in ancient India itself, it was considered normal.
It was considered normal. So where is it written? Where have we got the notion from that a female should be attracted only towards a male and male should be attracted only towards a
The
female?
normal norm has been made by us.
Made by the Britishers, yeah.
It's
That
been said,
Victorian
that's what I'm
era.
saying.
And
We have been normalized and grown up like with a mother and a father.
No, Parul, just divide the whole, animal kingdom in only two things, Nar and Mada. In the animals where they don't have, like relations like us, when all the females, female animals, they are attracted toward the male animals, and the male animals are usually attracted to the female animals, means it's a natural thing. We are not quoting like, just only because we are saying it is in every animal. So
absolutely, that's the reason for evolution and our existence for that matter. I agree with you.
Rare examples are everywhere.
Absolutely not disagreeing to what you are saying.
No. Rare examples are everywhere. So you cannot make them common or, like that, no? Rare examples are everywhere in every.
It is actually not rare, probably, because many people are afraid to come out of it.
Nowadays, it's not rare, madam, because nowadays it's a fashion. Everybody is excited.
Fashion,
Something different.
Is
What
it a
I
And
choice?
the only reason I can think of is have sexual gratification without getting fear of pregnancy. Possibly if they are of the same sex.
Yes.
Possibly, they are worried about
But there
going
is
to
some
another
genetic
opposite
component also.
sex.
These days, some genetic component has also been identified.
No, but that is the biggest issue and the cause. Yeah. But one of the causes of divorce.
By piercing their
That is
tongues and
one
their
of
like that. No, it's a different fashion, what I feel. Maybe.
I think this generation is
and
probably
if they
getting
don't come out
confused.
of
That is what I personally.
so, but
Okay,
then
let us
that
move
is
on.
I think we are deviating
that is
Yeah,
the
let
big
us move
reason
on.
for
This is the
divorce.
only-
non-judgmental with anybody walking down in our clinics, and we
Yeah.
want to increase our practice
No,
and we
no,
want to
we
be
will,
user friendly.
we will never
So
be
that's what we want
judgmental
to
for
do.
them, but it's just a personal opinion. Okay. This is an
Absolutely, sir.
endless subject.
Absolutely. People can have their opinions.
Agree,
of course.
agree. Yeah.
I think,
Okay.
Mother, let's take the next.
Just one
Next
statement.
question.
Can I make just one
No, next question.
statement?
Next question.
Yeah,
Okay.
one
It's already,
statement
it's
that
already
is this
9:10, huh?
homosexuality is a big reason for divorce. Yeah.
Madan sir, next question
Okay.
is
Yeah.
9:10 already.
A 27 years lady IT professional married since 6 months, not allowing her husband for vaginal intercourse, but allows foreplay. They are good friends of each other since long. Then how to evaluate and manage this case? How will you counsel? Again, I think we have discussed regarding this also. What is the problem of IT professionals or highly educated public? She don't want vaginal intercourse, but allows foreplay.
Might be
Ma'am, would you
vaginismus
like to take
also.
this question?
Yeah.
Might be vaginismus. We have to find out.
There may be pregnancy phobia also. They don't want to be
Yeah,
pregnant.
I think
This is also one of the reasons.
That can also be the reason. Yeah.
Yeah. To avoid the responsibilities and to be pregnant and all this.
Yeah.
This is the main
so.
reason.
Basically,
Just we can
But for
counsel them, but
pregnancy prevention, contraceptive pills are there,
yeah,
condoms are there.
basically
So many methods are there, no?
that we have to counsel.
Because vaginismus is much more common than we ever think. Because it's so
Many-
very common,
many
much
times-
more common.
Many times what happens, being highly educated also, they don't know the anatomy and physiology of reproductive organs. Many times.
Just last week, I had a similar patient in my
Yes.
OPD clinic.
And
I think we need to go into the history, why she has that phobia. We need to sit and talk to them, reassure them that it's natural. They might be having some phobias, or they might have had sexual abuse in the childhood. Some kind of, or they might be following some myths. See, I've seen, of course, this is for men, the Siddha, homeopathy, all these people, they say like, if you're masturbating, it's harmful, this, that, and all, and you can land up with problems and all that. So these people, there are so many myths hanging around. So they might have had some fears. So we have to basically sit and talk to them why, or they probably have fear of pain. A lot of people think first
Yeah.
intercourse is very painful, it's going to bleed heavily. A lot of them have that kind of myths, they have it in their head. So they can't allow the other partner. So we have to sit and talk to them, basically why they are phobic, and possibly gain their confidence and rapport, and slowly maybe multiple sessions will be required, maybe cognitive behavioral therapy as well. And the opposite partner also has to be very considerate in these cases.
Vaginismus is very common. See, in a month, I see at least 30 new cases of vaginismus, 30 minimum. That's the minimum number of cases I see.
Oh,
So in the last
it's
2 years,
rising.
in the last 2 years, Poonam must be knowing Poonam because we have presented the data in our conference. So in the last 2 years, I've managed around 72 couples with vaginismus, severe vaginismus. We do a batch therapy, inpatient therapy for 15 to 20 days. So I'm surprised that most of them are doctors, IT professionals, and belong to the higher socioeconomic status. You know?
Yeah, this is the problem in high societies.
Higher societies,
Yes.
correct.
and they will the husband will also tolerate it, or will not be tolerate, or I would say is okay with it, because maybe he's too fond of his wife, or he doesn't want to point out anything. So I think generally they will accept it, and they may not come within few months, or 6 months of marriage.
Months, no,
I have
few years,
seen
no.
Come after
they
years.
don't come for
Yeah, after
years, 8 or
years.
10
6,
years,
6,
they
7,
do
7
not
years,
come.
Yes, yes.
non-consummation of marriage.
Yes, non-consummation of marriage is a reality, and especially people who are practicing IVF and IUI, the pressure of getting pregnant is so much, and
They are okay going ahead with IUIs, ma'am. But still,
but the problem with IUI or with IVF is the transvaginal sonography is a big issue. So they want sonography,
abdominal sonography, that is what they want from us.
and they want IUI under general anesthesia.
Yeah.
So
Under not GA, that's what they want now.
Yeah. Okay.
So,
Thank
so
you. Let us move ahead. Next question is for Girish sir. What is your opinion about ideal age of consent and marriage? What is your opinion?
Consent for?
Consent for sex.
See, according to Indian government, the age of consent for sex is 18 years till now. And according to the, new amendments are required to avoid the POXO Act in some cases. For example, if the boy and girl, if they are having consensual sex, so it should be 16 in my opinion. This is my opinion.
Okay.
16. And according, in many areas of India, again, they are getting married before 18 years of the age. So in such cases, the POXO Act is very difficult practically also, because it's very difficult for police department also to act. So the consent of the sex should be 16 in my opinion. And age of the marriage, I think 18 and 21, it's okay in my opinion. For girls, 18 and 21 for the boys.
Yeah, absolutely right, sir. Actually, since few years we have demanding to the government of India, but I think government has denied the demand.
No, the things are going on, because there are
Ah.
many cases where it's very difficult to take action even by the police department or by judiciary also. For example, to get married before the 18 years is very common practice in most of the peripheral areas or most of the states of India. And
Yes.
these things are practiced since years together. So when the marriage has been done, the things are again happened, and when the cases comes to on the dais or on the floor of the POXO, then they are getting many difficulties by the social organizations and the panchayat and all these guys. So the things are going on, and probably the age for sexual consent will be 16 very soon. Just it will be a newer amendment in the POXO Act. The things are going on, and that should happen, because in many cases the boys and girls, they are having the consensual sex before 18 years of the age, correct?
Yes, true.
Yes.
Yeah, and they are educated well, and they can understand everything. So probably that should happen, and 16 should be the age of sexual consent, in my opinion.
Yeah. Yeah. Coming to the question related to this next question, anyone can take. How will you manage the case of an unmarried pregnant lady in your clinic if she is below 18 years? If she is below 18 years, if she is above 18 years,
I can talk for 1 hour on this. I think let everybody talk, then I will talk on POXO.
yes, anyone can opine in short.
Since the time is short, Girish, you should just tell the important points.
When a girl
I feel
below 18 years of the age comes to your hospital, so there are many aspects. First thing, you should, for example, if she is coming to your hospital, so according to the POXO Act, any boy or a girl who is below 18 years of the age, they are defined as a child. And it is the duty of any person, not only the doctor, but the media, the relatives, or anybody who is having the apprehension or the knowledge of any boy or a girl getting involved in any kind of sexual activity, or they are used for some sexual activity, then it is their duty to inform to juveniles, special juvenile police unit, or the near police unit, or CWC, that is the Child Welfare Committee. And if they are not doing like this, then they are punishable for the imprisonment of 6 months or with the penalty. So whenever such patient is coming to your hospital, first thing what you are supposed to do is first educate them regarding the POXO Act, and just inform them that whether even if she is not going to do MTP or whatever, if she is denying the treatment, then it is the duty of the doctor to inform to the police. And this is not the complaint. This is very important. This is not a complaint. This is just an information for the further investigation or further procedure. And if the doctor is failing for that, then the doctor is liable for the punishment. Just write down one FIR copy. Just read loudly in front of that patient, and send 2 copies of the same paper to the police department in front of that patient. Because if you are doing against the knowledge of that patient, and when the police will reach to that person, then that patient might think that you have complained for that case, and then the things can be kuch bhi ho sakta hai uske andar mein. Now if the patient is coming to you and she is pregnant, and if you want to do MTP, then you have to write down a letter to the police department that such and such girl of such and such age, with this address, this telephone number, she has been to your hospital, she is pregnant, so this is for your further information. And just this, I mean, your duty is still this. There is no need to take permission for MTP. Even you should write one sentence that please collect the product of conception from my hospital within 72 hours for further proceeding. Then you can proceed for the MTP. Then after doing that MTP, collect all those POCs. Then I mean, mount that POCs in normal saline and keep it in the refrigerator for 72 hours. If the in most of the cases, the police will come to your hospital, they will collect the sample for the further proceeding. And if you are not giving, or if you have forgotten to give all these products of conception to the police, then another case, that is destruction of evidence, can be against you, because that is the only, I mean, that will be the only like evidence to prove the paternity of the person against whom the police is going to take action. And if she is above 18 years of the age,
Dr.
there is
Girish,
no
can I
need to-
just, Dr. Girish?
Yes, ma'am.
Dr. Girish,
Yes.
sorry to interrupt. So, since you have completed till the age of 18, I have two queries in
Yes, madam,
mind.
please.
Suppose she's a tubal pregnancy, less than 18, tubal pregnancy, and she comes in a state of shock.
Yeah.
Secondly, is so since we have to preserve for abortion,
Madam, if
medical.
it is, no, see, if it is tubal pregnancy and if you
Because
have,
we need the pills.
madam, your voice is not clear.
Voice is not. Whites.
Madam, you can off your video and then you
Okay,
can.
I will type the message. Okay.
Okay, madam, just want to
All
know
right.
that if it is a tubal pregnancy, then what to do? If you are enough smart, or if you have that kind of answer to give to the police that it was not possible for you to collect the POCs. For example, if a girl with MTP complications comes to your hospital, I mean, she has done MTP somewhere else, and she
Yes.
landed up in the complication, then you have to just inform to the police, then there is no need to provide them the POCs. Okay.
Yes.
The only thing is that you have to inform to the police about her involvement in the sexual activity. That is the only point. And for the further proceeding, and if it is in your like area that you can provide the sample, then and then only you have to provide the sample. And if she is above 18 years of the age, then there is no issue of POCSO Act. You can go for MTP. There is no need to take consent from any other person, but only if you are going for surgical management, then you have to take the consent for anesthesia or for the surgical management in such cases. This is in very short.
Yeah.
Madan sir,
The next
what
question
was
would be for
your
Sudha,
expectation
ma'am.
regarding this?
Yeah, last. Yeah,
I think
continue,
we'll be
Parul.
having this last question because of shortage of time, but we are really enjoying this discussion and insights from each one of you. So Sudha ma'am, this is for you. If an unmarried teenager walks in your OPD for advice about best method for contraception to her, and also if that person who walks in happens to be a close friend's daughter, so what would be your take on that?
Is
Yes,
ma'am there?
because,
Yes.
yeah, am I audible?
Yeah, yes, ma'am. Please.
Yeah, because the network was not good, so I've switched off the video.
Okay.
Yeah. So this is a very tricky question. You know, your friend's daughter has come to you for contraception advice. I think so. Here you have to be really non-judgmental and treat her like adolescent who will come to you, because and I have really taken a lot of tips from Dr. Sita Lakshmi on how to tackle this. I think it's important to have a good rapport with this girl and try to really make her comfortable. And she should be really told that, okay, she's not going to, or you are not going to divulge all the information to her mother, because that's one thing which she will be really worried. Please don't tell
Madam, your
my
voice is not clear.
parents.
Ma'am, your voice is
Is it? I
cracking. We
don't know. I
cannot
think
hear.
Parul.
So then I will not talk. Let some.
Parul, can I answer?
Yes, sir, absolutely, please.
Yes, please.
First thing, see, when any girl below 18 years of the age come to your hospital, and if she's asking for the contraception advices, then there are two duties of yours. First thing, to make her aware of the consequences of the unsafe sex as a doctor, and the another duty to follow the POXO Act. So the in-between thing is, you should advise her the consequences of the unsafe sex and what can be the bestest options for her or for any person to enjoy the sex how to avoid the pregnancy or the STIs. But please don't write anything on the paper and don't hand over those papers to her. And coming to your second this question again, you should not be judgmental and just treat her as a patient. I mean, casual patient. And if you are being judgmental with her, and if you are giving her extra advices, then she will never come to you again. Probably she will go to some other place where she might get, advices not better than you. So it is always to loyal with her. Don't be judgmental and just treat her as a casual patient. And there is no need to get involved emotionally with that girl.
Yeah, Deepa ma'am, would you
Yeah.
like to add?
I think the most important is one is confidentiality and maintaining privacy and winning the confidence of the patient, establishing a rapport with her. First of all, I'd like to know whether she has a stable partner or is it some random one-night flings before I give the kind of contraception that she requires. I need to know more about her sexual life. So that's very important. Then the problem with these people is they don't have the finances to acquire regular contraception. So that's again a problem in addressing adolescent contraception or unmarried people also, people who are not working. So yeah, we got to be non-judgmental. We got to look into all aspects, including finances, what is her partner choices, different partners, same partner, regular sex or infrequent sex. So for instance, if someone's going to have a random one-night flings or something, we will be advising them barriers, right? And if they are in a stable relationship where they need to continue having, then we can offer OC pills or whatever. So that's very important. Her pattern of sex life is very important for me. The number of partners and what is her finances, everything is important to me. So I'll go into all these. I'll talk to her like I talk to anybody else. And firstly, I'll tell her that I'm not going to divulge anything about this to her, to my friend or whoever, her mom, the last person who I will tell. So,
if she's daughter of your close friend, then practically speaking, what you will do? If she's daughter of your close friend.
Judge me for judging her. So I'll be
That is why this panel is
my
good.
daughter will hate me for this. So I'll be doubly careful.
Okay. Yeah,
Can we just take
got
one
good
more
input.
question? Can we just take one more question that married couple wife demands sex daily? Can you please read out? Because I'd like to add.
Yeah, please.
Yeah, that's an interesting question. I wanted to, thanks for
yeah, because I just wanted to
married
say something.
married couple case scenario. ठीक है, married couple, wife is demanding sex daily. If she doesn't get, she has to masturbate on that day. Daily sex is not possible for her husband. Husband is scared of her nature. How one should tackle this case? How
May
will
I
you?
take it up? May I take this question?
Yeah, please go ahead.
See, at any age, that is, if there is hypersexuality in the female partner, then you cannot just be casual about it. He needs to be investigated properly. Many a times it can be due to underlying psychiatric issue also. So psychiatric consultation is a must for such patients. And along with that, we can give that is SSRIs like fluoxetine, sertraline, paroxetine, etc. They can be given, but you cannot just give them that medicine and say that it's okay. You just take it and you can't just leave them, because almost always hypersexuality in women have got some element of an underlying psychiatric illness. This is one point.
What about men? Men may be hypersexual.
In men also, yes, it can be due to that, but much more than men, in women, it is always having an underlying psychiatric issue. Men, it need not always be like that. See, there can be some disparity also, no? Men have that urge more than the women. That is most of the time. I mean, it's a generalized thing. In some cases,
Same case is one of my close friend is like this type of situation. He needs daily sex from wife. Wife is scared of his nature.
Yeah.
He's
So
my
we
close
have
friend.
to put them, we can put them on
So
fluoxetine, sertraline, and
what you
paroxetine.
did
They
in your
definitely
friend's
help.
case? What you did in your friend's case?
He's absolutely psychologically normal. He's a very clever boy and absolutely psychologically normal. He was my partner for undergraduates, and he used to masturbate daily 2 to 3 times.
No, I'm telling, in women, almost always hypersexuality is associated with some amount of psychiatric issues. In
Yeah,
women.
maybe. Maybe.
I have had a similar patient, ma'am. The husband, newly married, demanding sex 3 times a day. And the wife is having so much pain and she's unable to cope with this. The mother-in-law brings the girl to me. I really didn't know what, and I really didn't know what to do.
Paroxetine, sertraline, they all help a lot. That is, you can give them for 2 or 3 weeks, it helps a lot.
But counseling plays the very important role in such cases.
Counseling is important, yes.
Couple counseling.
Many a times they are not in control of their urge. They cannot control it. They need some drugs to help them with that.
Yeah.
Just counseling is not enough.
Very often, I think it's one of the reasons for infidelity.
Yes, because they don't get what they desire at home. So such people will definitely benefit from medicines. So that's just one point which I wanted to make.
Yeah, now we are
And
near
other
end
one,
of the
I
session.
was also curious about the other one. There was a 65-year-old male and a 55-year-old. Can we take that question? A few minutes.
Okay, we
You
can
can
take
answer that for me.
If 65 years husband wants regular sex with his 55 years wife, but she's not desirous of sex, how to counsel this couple? What are the obstacles in such population?
It's quite a common scenario, I think. Right?
It's very important not to dismiss the man's concern by saying, come on, you are now 65, do some bhajans, go to some ashrams, etc.
Again, psychological counseling of couple is very much necessary in such cases. That is not abnormal thing if he expects sex from wife, but we have to look for
comfort of his wife also.
Any pathology or any. We have to counsel them. What are the postmenopausal symptoms, and she has less desire. She might be having pain due to the vaginal dryness. But we can advise some lubricants also. As per the symptom or as per the problem, we have to go ahead.
May I just say?
Yeah, please.
Sure, ma'am. Yeah. So first thing is, I think we should speak with the husband and wife separately to understand their individual concerns, desires, and any underlying issues. So here in this case, a husband has approached us first, because he has already approached us saying that his wife is not interested. So when we talk with the wife after that, if you start preaching and giving suggestions like, you must do this, you must do that, then we can be sure that we won't be able to help the couple. So after individual consultation and trying to find out their concerns, then we have to do a complete medical evaluation to find that there is no medical conditions affecting sexual desire, hormone imbalance, diabetes, arthritis, back pain. All these can cause issues. Sleep issues, insomnia can occur, mental health status, anxiety, depression, like Poonam so very nicely, beautifully mentioned, that is depression due to that emptiness syndrome, and so many other things can occur. Then joint counseling can be done. So then we have to educate them about the normal changes in sexual desire with aging and how it can affect each partner separately, right? In males and females, the effects are different. And sensate focused therapy is very, very important at this stage when they've almost forgotten any form of intimacy. So sensate focused therapy, I'm sure that most of you must have heard about it. It is developed by Masters and Johnsons. It is a structured form of touching type of exercises, progressing from non-genital to genital. Sensate focused therapy, I have advice for many, that is middle-aged and older couples, and many of them are very happy with that. And then slowly non-coital forms of intimacy. As Poonam said, that is a concern for privacy is also there, to ensure that privacy is there. And frequent outings. Recently, I had a couple where the husband and wife had taken consultation from me saying that till recently, they were having a very good sexual life. The wife is around 62, husband is around 69. But then their son and daughter-in-law with their 2 grandchildren, they came from US for 2 months vacation. Throughout the 2 months vacation, the 2 grandchildren were lying with them, were sleeping with them in their bedroom, while their son and daughter-in-law were in a different room. So in that 2 months, they were not able to have any sexual intimacy at all. And after that, they just drifted apart. They couldn't get back to the original thing. So this is also very important, I think.
Yeah. Appropriate.
I have a question for Sudha ma'am.
Yes.
So in such cases, how long can we advise vaginal estrogen creams? Recently, they're saying like they can go on and on. Is there a time frame?
Not
to
really. I
advise
think
us?
estrogen creams can be used. They are really very good, and they can be used. I don't think there is any literature which says that you cannot use for a longer period of time. But this situation, I also felt one important question which I would like to ask the wife or the husband as to what was their pattern before. Now they're 65 and 55. But what was it before that? Is it suddenly it has come up? Or it was always like this? So then if it was always like this, or it was something new, will there be a difference in the approach? If anybody can throw some light on this issue. I hope I've made myself clear. I am audible. No.
Madam, you are audible.
Sorry?
Yeah, you are audible.
Yeah. So,
Ma'am,
I
please.
think it's heavy raining in Mumbai probably.
I don't know. Yeah.
Your net is not, your bandwidth is very low.
Ma'am, please repeat the question, please.
Okay, I'll switch off my video. Basically, you said 65-year-old male. Is it better now? No.
Yes, madam. Go on, please.
Breaking.
65-year-old male who wants intercourse every night with his 55-year-old. I just want to know, is this a situation, or is this pattern he wanted right after their marriage? Is it or it's something new? No.
The voice is breaking, ma'am.
Sorry. Okay.
Okay. We had a lot of discussion, fruitful discussion, and very nice inputs and comments from every panelist. Shall we end the session now? Parul, unmute yourself. Please unmute.
Parul, unmute yourself.
Yes. पूनम मैम फ्री हो गए ओपीडी से?
नहीं मैं तो हट गई थी इसलिए कि it was a panel discussion and panelists should be there, but
Poonam madam, we missed a lot of comments from you.
There is one question from Poonam madam. One question.
Okay.
When can I ask Poonam ma'am?
Yeah, sure. Please.
When 25-year-old unmarried girl walks in for hymenoplasty, what next? What is your opinion about such surgeries? What will you do?
See, these are the cases where actually proper discussion with the female is a must. She has come to you with a guilt that she was sexually active and she is going to get married to the other person, definitely to the other partner. And now her whole marital life is going to be devastated with the fact the day she is going to get married and her husband is going to get the fact that she is consummated. Males are also knowing that a female can lose her hymen without the sexual activities also. This is the fact. Society is aware now, but since she was sexually active, she has the guilt. So a normal female who was not sexually active is coming to you that, am I a normal person? Is everything okay? And you are not going to tell that you are not okay, you are not having hymen. It is our duty. But she is not that worried as the girl who has been sexually active. So in my opinion, this is my personal opinion, that we have to do that hymenoplasty. That single simple operation is going to save her emotional as well as every aspect of her marital life. See, I am doing this, and many females are coming, and they never go to the nearby doctors. They are coming from the other cities and other places. So one girl came to me. She was sexually active with her boyfriend. They were in live-in, and now they were not going to get married somehow. She was going to get married to a scientist. And then she told me that, ma'am, he is an educated person. Now we are going to get married. And these days we are talking a lot and we are becoming intimate during talks also. And he always asks that, I have heard that girls, when once the first penetration is there, they bleed. And there should be like this and that. Now, what next? Is there any counseling going to do something? Is there something, whatever you are going to do is going to save her? If she is not going to bleed, or if I told her that there should be some resistance, you may not bleed, but he should feel. Usne bola, ma'am, he is a scientist. He knows everything. If I'm not going to have some kind of reconstruction, then he'll get to know that I was sexually active. Please save me. And I did that. And I'm happy that I did that. So you have to do that.
Yes, 100% we should go for it, because that simple procedure can save the psychological, I think, the future of that girl. Because even if you are not doing, and if she is under tension, no, her performance during the sexual activity will be totally different. And she will be very much confident if you are doing that hymenectomy. So I agree with man that we should go for that. And that is the right of that lady.
Exactly so. Females are sexually active, males are also sexually active.
Exactly.
And these days, patients are coming with vulvovaginitis, recurrences, and you are asking, she says that, yes, ma'am, I'm sexually active. I got to know that my male partner has been sexually active with several females. These days, things are going haywire. They are coming with multiple, like my friend is in HIV ART center, and she's telling that number of new, the adolescents are coming with HIV, with multiple sexual diseases. They have multiple sexual partners. They have all kind of experiences. She is the first one. She is the sexually active one. She is the... So during their marriage, if she is going to get married, and if she is demanding something to just safeguard her post-marital life, we are service providers and we have to give it to her.
I agree to Poonam, ma'am, because being in aesthetic practice, it is what the patient demands out of you, and you should just tell them this is the realistic picture and this is what you're going to get. And if they still choose and they want to go ahead with it, I think, yes, we should offer that to them.
And there is hilarious things are that patients are coming for second honeymoon and they are coming for hymenoplasty.
Absolutely.
They are
That would
saying
be a
that I
practice
just
in
want
here
to give
also.
that experience to my husband. Oh my God.
Ma'am, I had one patient, a similar patient. She came on her 25th anniversary that I want to give this to my husband, that he should have that first time experience. There
Can
are
you
people,
imagine?
even in cities like Nagpur and everywhere, people do come in for procedures like this for this also.
Exactly. So this is the emotional part of sexual medicine, So different, different types of, we are talking about attractions. We are talking about their thinking, their behavior towards the partner and other things. So how do they feel during penetration? How do they feel? What they want? What are their expectations from that sexuality and other things? This has to be discussed and this has to be provided to them.
Parul,
Yes.
in regard to the second honeymoon, you can treat the psychological or anatomical aspect, but what about psychological aspect?
Regarding, sir?
Second honeymoon.
So psychological aspect is this, that when you provide them that vaginal tightening and when you do that hymenoplasty for them, I think they, as it is when women reach their perimenopause, menopause, they start feeling that they don't look good, they don't have that beauty anywhere. So we have like, I think I can present a case series where we have done like 7-8 of them in this present year itself. They feel that if not the entire look, at least the vagina and the sexual act should be something what he felt when we first got married. So that's the thing. And I think it helps them in a psychological way also, that, okay, I might look old, but at least my intimate areas are as good as what a 30 or a 25-year-old girl is. So that's also what comes into play.
And this is the
See, this could be a
pre-decided
placebo
psychological thought.
effect also. This could be a placebo effect, but yes, they are satisfied.
They are
So
very
this is going to this is going to add on to their pleasure actually.
Ma'am, what another procedure they demand, like vaginal tightening?
Tightenings
Absolutely,
are
sir.
there most of the which I get in unmarried girls, like they are going to get married and they have been sexually active. There are three things: genital bleaches. They want everything perfect and hypopigmented, not darkening. Second is hymenoplasty, and third is sometimes labiaplasty, because they think, and it has also
Then we lost Poonam ma'am's voice.
the partner will think that it is not the virgin type of appearance.
Yeah.
The Barbie look is something which they really demand for these days, that, you know, it should be all. I don't know. I mean, it's like what they demand and how they desire. And that's what we, being cosmetic gynecologists and aesthetic gynecologists, we definitely offer. And like Poonam ma'am is saying that they want those vulval lightening procedures and things like those. So we have come up with vulval spas and things like that, where we do PRPs with derma rollers and things like that. So I think they all, it's a cumulative effect. It is psychological plus what the effect is going to be in front of us.
Madan, I
Chalo.
have witnessed one talk of Parul in Nagpur regarding this. I don't know that Parul know it or not. Please keep her one talk regarding this topic and
Yes,
look
sure.
and all things.
He's the best speaker for that.
Yeah. Parul, तुझं टॉक ऐकलंय मी नागपूरच्या कॉन्फरन्स मध्ये.
ऐकलेलं आहे का सर तुम्ही?
फेस टू फेस अगदी.
Oh, thank you so much, sir. Thank you so much.
Chalo, let us stop here. It was a very wonderful and nice discussion, lengthy discussion. Shall we move on to vote of thanks, Parul?
Yes, sir. Yes, sir.
Please proceed.
So thank you, Madan, sir, for that opportunity and joining hands with the Amogs YTP committee. I'm really thankful to the, chief guest for today, Dr. Sunita Tandulwarkar, madam, to, figure out time from a busy schedule. I'm thankful to all the three guests of honors, Amay, sir, Parag, sir, and Ajay Mane, sir, that they have blessed this webinar with their presence. I'm so thankful to each one of the speakers for their elaborate and illustrious talk, Deepti ma'am, Poonam ma'am. I mean, it was marvelous, out of the box, and the way you presented your slides to the point and, giving us such good messages. So that was really fabulous. All the chairpersons for giving their lovely remarks and giving in their experiences, sharing their experiences. I'm so thankful to all my panelists. I mean, their opinions, their insights, their experiences, how they have thought through a lot of things. It has been marvelous. And I think me and Madan sir are really happy that we had this discussion today on, this forum, and we had all you people, who spoke so well. Thank you, Mane sir, Girish sir, for that, POXO Act, tidbits of whatever you have given us. It's like really important, and medical legal aspect really makes it, important for us whenever we are practicing. Thank you, Sita ma'am. Your knowledge is excellence part. I mean, some few things we as gynecologists probably, ignore, but the way you have taken it is really something which is commendable. Thank you, Deepa ma'am, for your experiences, the way your patients, and Sudha ma'am, the way she has shared about, the lesbian pairs who've come for surrogacy and things like that. It has been really a nice journey all this while. These 2 hours for the panel discussion has been really marvelous. And thank you to Corona and our viewers and our delegates who have been seeing and, have been a witness to this marvelous session. Thank you, Corona people, for their support as always. And Madan sir, you have been a gem of a person, and sexual medicine under your guidance, and you taking it up for the past tenures at Amogs has reached really, really bigger heights. So, all the best, sir. And I'm wishing our, greetings and our luck to all the aspirants for their candidature for whatever post they are contesting for.
Yeah,
And Madan sir, on behalf of all the panelists, thank you, Madan sir, and thank you, Parul. And Sita madam and Poonam madam, really, it was very wonder to listen both of you, because I have already listened everybody, Dr. Deepti, Deepa, and everyone. But for the first time, I was listening Poonam madam and Sita madam. Hats off to
Thank you, sir.
both.
Thank you,
Thank
sir.
you, thank you, thank you very much.
this topic was idea of yeah.
So in the end, I can
Uh,
say we have reached the orgasm. So
Yeah.
good night, everyone.
Agreed.
Parul's idea only. And thank you
Thank you
all.
very much. I think I am indebted to Dr. Madan
Commendable
and
job, Parul. Yeah,
Thank you, ma'am.
commendable
Thank you,
job.
ma'am.
And
But
this,
I mean, Madan sir has really brought in you all, who has, that's the point. I mean, I must have just popped in with that idea that this is what we want to do. But with you all people there and taking all the topics and subjects the way they should have been, and, given the insights, I think it has done justice to whatever we thought we wanted to present to the.
The same panel we will present in Amogs and Foxy also.
Yes, sir. I think we really need to do this.
Yeah.
Yeah, I think just one request, Dr. Madan, keep calling me.
Yeah.
Actually, I was just thinking, why didn't I go for sexual medicine committee? Why am I going?
Oh, please don't go for
It
section.
was fabulous discussion. It was fabulous. Poonam ma'am, Sita ma'am, and everybody, Dr. Deepti ma'am. I mean, it was fabulous. Absolutely. I enjoyed today's work.
Yeah,
Thank
wish
you
you
so
all
much.
the best. All the best. Wish you all the best. Dr. Deepti, Deepa ma'am, everyone. Yeah. And thank you for joining.
Good night.
Good
Yeah.
night.
Good
Thank
night.
you.
Good night.
thank you. Bye.
Thank
Bye
you
bye,
so much.
everyone.
Bye.
Bye bye,
YouTube,
Deepti ma'am. Thank
YouTube
you,
link
Madan
is
sir.
there.
I'm logging out.
Yeah, YouTube recording link is available on our group.
Okay, sir. So we need to upload it on YouTube channel of Amogs also. So if you could
Yeah,
give it to me,
yeah,
I'll
we
share
will
it
do
with the
it.
concerned person. We'll
It
do
is
it.
shared on the group.
Okay, sir. Okay, sir. Thank you so much.
Yeah, thank you.
Hey, Varsha. How are you? Long time.